inform other attendees of any such recordings. I'm only aware at this time of the recording by the local scene. Pursuant to Chapter 2 of the Acts of 2025, an act relative to extending certain COVID-19 measures adopted during the state of emergency and signed into law on March 28, 2025, this meeting will be conducted via remote means and in person. Members of the public who wish to watch the meeting may do so in the following manner. Tune into the local scene government cable access channels Comcast 9 or Verizon 47 and watch the meeting as it is aired live, or watch the meeting live on the local scene website. Members of the public who wish to participate in the meeting may do so in the following manner. In person, here at the Great Hall, which is on the second floor of Town Hall, 26 Court Street, Plymouth, Massachusetts. Remotely, you may participate by clicking the link on our agenda, which is posted on the town's website. Let's start with the pledge to the flag. Please join the board. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. We're going to start tonight with a public hearing relative to an underground storage license for High Rock Cranberry Crescent, LLC, which is at 2 Commerce Way. In accordance with Chapter 148 of the Massachusetts General Laws, as amended, notice is hereby given to the public that a hearing will be held on Tuesday, December 2nd, 2025, at 6 p.m. to consider the application from High Rock Cranberry Crescent, LLC, for license of underground storage of 35,000 gallons of flammable liquids and 6,000 gallons of combustible liquids located at 2 Commerce Way. This is for self-service gasoline, diesel fuel sales with a retail store. Anyone wishing to be heard on this matter should plan to attend the meeting. I'll open the hearing. It looks like we've got the petitioner here. Could you please introduce yourself?
Good evening. For the record, Hussein Savinchkid with Freeman Peterson Inc. out of Salem, New Hampshire, representing the proponent. Basically, it's a new gas station development that's gone through the permitting, local permitting in town, received zoning and planning board approval, and we're in front of you guys for a fuel storage license for, as you stated, the volumes that you stated. It's basically 2 underground double-wall fiberglass fuel storage tanks, 3 compartments in one tank and 1 compartment in the other, so 4 total compartments with the volumes that you have. And I brought a site plan. I know the site plan was submitted, but there's a color rendering of the site plan for anyone that might be interested. But we're basically just trying to get the fuel storage license.
Thank you. Are there any questions from the board? Mr. Canty?
Yeah, can you show the site plan? All we have in our packet is the notice of the hearing.
Oh, really? Okay. So I can go over that. Sorry. So basically, it's on the corner of Commerce Way and Carver Road. Gas station access off of both roads, 1 driveway off of both roads, a canopy with 6 fuel dispensers, providing fueling positions for 12 vehicles, a convenience store located in this area, and then a tunnel car wash along Commerce Way. Car wash queuing would be in this direction, exiting back in this direction.
So you on the side of Carver Road, that's with the market basket? So you're like...
I believe the market basket is in...
Up, yeah, up there.
This location.
Okay. And you'd get into, if you were driving up Commerce Way, you can get in on the right, and you can also get in from Carver Road?
Yes, correct. So coming up Commerce, there's a driveway that's basically a right-in, kind of a
Yep.
right-out only, and then Commerce Way, you have full access.
And is there going to be any signaling on the Carver Road? There's signaling at the junction of Commerce Way and Carver Road. Is there going to be any signaling at your...
For the driveways? No.
Yeah,
That's
okay.
not warranted.
Okay. Thank you.
Mr. Quintel?
I just have a couple of questions. I heard you say double wall on the tanks, and I've sat through a few hearings in the other boards before, not on this particular case, many years ago. So are those alarmed and that extra layer of protection?
Correct. So the double wall
Okay.
fiberglass, it's kind of like cardboard, if I dumb it down a little bit, but it's like cardboard.
Can you
It
get
has-
closer to the microphone, please?
Oh, I'm sorry. So it's like a cardboard, but obviously made of fiberglass, pretty thick. There's an interstitial space between the 2 walls, I should say. And that's constantly monitored. There's monitoring for the sumps that are attached to the tank. The product piping is double wall going from the tank sumps. I can go into
No,
a lot of
I
it.
I figured it was, but I
Yeah.
have to ask the question.
Yeah, it would all comply with Mass DEP requirements.
Okay, are you in any of the well zones, 2 or 3?
Not that we're aware of, no.
Not that you're aware of, but if you were, that trigger something else?
That would have come up during the permitting
Okay,
process.
All right,
yeah.
okay. So, thank you.
As Mr. Canty indicated, we don't have anything in our packets. I've had a chance to sit on the Zoning Board of Appeals, and when we were looking at plans of this nature, we would see not only the site rendering, but we would also see information about the tanks and where they were buried, you know, how they were going to be constructed, what the alarm system's going to be associated with them. And then Mr. Quinto brings up a good point, even though you're not in Zone 1 or 2, but obviously these plans would show us where these proximities were, if they were. So right now, we're just basically taking your presentation and the answers you're providing without any documentation. So I'm not prepared to vote for this tonight until we get the proper materials submitted to committee.
So again, we have been through all the local municipal boards
No,
that
I
would look
understand.
into
I
the planning
understand.
department,
Yep.
would look
I
into
understand
any of
they
the
went
well
through the planning
setbacks.
department. I understand that. But here tonight, my job is to look at the plans and the materials. that
We
you-
do have
Yep.
fuel system plans, which generally,
don't have
it's
them.
it
Okay.
goes through Mass DEP
Correct.
as well as the fire department.
Yes, and I would like to see those. That was my point. Thank you.
Anything else from the board? Is there anyone in person who would like to speak in favor of this application? Anyone online? Is there anyone in person who would like to speak against this application? Is there anyone online? All right. Hearing and seeing none, thank you for your presentation. I'll bring it back to the board. What is the pleasure of the board?
As I indicated,
You good?
as I indicated before, I would like to see more material. Obviously, the petitioner has spent time providing information to Mass DEP and the different boards that had to make decisions, but I would like to see those so that I could confirm and verify the comments that he's making with the plans that are in detail. So I'd prefer that we maybe hold on voting for this and take it up when that material's been supplied.
Mr. Canty?
If Mr. Cohan feels uncomfortable voting, given the lack of materials, I would also recommend that we postpone it until we have those materials. So that I understand that the other boards and panels have looked at it, but it is our job, as Mr. Cohan correctly states, to do an independent review. And unfortunately, I don't know what you did submit, but all we did receive was the notice, and that's it. So,
Are there any objections from the board if we have the materials submitted to us and make a decision at a later date? All right, hearing and seeing none, we'll ask that you work with town staff to provide those materials, and we'll take a vote at a future date.
Just to be clear, materials that are required, so we do, I'm a fuel system engineer, we do fuel system plans. I'll submit those, no problem. What other materials are you looking for?
Mr. Cohen? Microphone?
Sorry. So we're looking for the information pertaining to the tanks, where the tanks are buried, and the details that you provided Mass DEP and the planning department associated with those engineering plans for the site as it relates to the tanks and how the tanks will be connected to the, all the relative information that you provided regarding the tanks that we.
To the other local boards as well?
Correct.
Site plans, grading, drainage, everything? You wanna
Just,
see everything.
the focus of tonight is the tanks.
Just the tanks?
So tanks, we're focused on the tanks. So the information relevant to the vote we have to take in improving the underground storage. So anything that you can think of that you've submitted to Mass DEP, the planning department, the planning board, the steering committee, I'm assuming you went to
understood.
the steering committee, you would have that information. So thank you.
Mr. Canty?
I would add something similar to what you have on your demonstrative would be helpful as well, so that we can look at where the
The overall
tanks are
site
going to be
plan.
in relation to the rest of the construction and as well as where it's going to fit in the geography of that specific area. Thank you.
Thank you very much.
All right, when would the next meeting be for this, just if I can ask?
Mr. Janeo, can you connect with the applicant and schedule that for us?
All right.
Thank you. All right, I'll close the hearing for now. Well, do I close it or adjourn it to a future? We'll postpone it to a future meeting. All right, moving on in the agenda. We have several licenses, common victualler, license in conjunction with the liquor license, and then a whole slew of 2026 renewals, which are in the packet. What is the pleasure of the board?
If there are no questions or comments or requests to take anything individually from my colleagues, I would make a motion to approve the listed specific licenses as well as the 2026 renewals as a group.
Mr. Canty moves as a group. Is there a second?
I'll second.
Ms. Iaquinto seconds. Any discussion? Hearing and seeing none, I'll call the roll. Mr. Cohen?
Yes.
Mr. Quintel?
Yes.
Mr. Canty?
Yes.
Ms. Iaquinto?
Yes.
And myself, yes. They are approved. Moving on to administrative notes, there are 6 notes listed. The pleasure of the board.
I'd like to, if it's okay, take I had a question on number 4, the Massachusetts Department of Environmental Protection Recycling Dividends Program.
Okay. Is there a motion to approve then 1 through 3 and 5 and 6?
I'll make that motion.
Mr. Cohan makes the motion. Is there a second?
Second.
Mr. Canty seconds. Any discussion? I'll call the roll. Ms. Iaquinto?
Yes.
Mr. Canty?
Yes.
Mr. Quintel?
Yes.
Mr. Cohan?
Yes.
And myself, yes, it's unanimous. On number 4, the board will accept a grant in the amount of $9,600 through the Massachusetts Department of Environmental Protection's Recycling Dividends Program to support the purchase of recycling equipment and the promotion of waste reduction programs. Mr. Cohan? Microphone.
I just had one question regarding that grant that we received. I saw the supporting docs that were provided. I was wondering, is there any specifics on what that money will be spent on and what it will be committed to? Obviously, recycling activities associated with the town, and I was just looking for a specific. Was there anything that you could elaborate on from the staff's position?
Thank you, Mr. Cohen. No, but typically, I don't know specifically what the department will be using it for, but typically, because it's such a small amount, it's used to promote different recycling programs, whether it is typically some towns have a fix-it day where people bring in material, I don't know, stuff that they have at their house that doesn't work, and we hire a person to come in and fix it. Or it could be to buy the pay-as-you-throw bags. It could be to promote different recycling activities throughout the town, because this is a yearly program that Mass DEP does, and what ends up happening is the town engages in a variety of different activities that gives us points, and based on those points, they provide the town with $5,600 or $7,600, or in this case, $9,600 that can only be used to promote recycling activities. So I don't know specifically what those activities are, but I can check with the DPW.
I have had a chance to attend the Net Zero Committee's deliberations over the last couple of months. They're always looking for opportunities to expand the educational component. So I was just curious if, as they move to make those expenditures, that they're reaching out to Mike Cahill and his department and his efforts to coordinate with that committee. I know they have the swap shop, which has been a successful endeavor in planning it for the spring. So I just saw that, was curious about where the money was being spent, and if there's been a dialogue with the committee with maybe they might have some ideas.
Absolutely, and I'll make sure that the department reaches out to the committee.
All right, thank you very much.
Is there a motion? Mr. Canty?
There is a comprehensive list of what the funds can be used for on the Mass DEP website if you Google the grant. So there's a 4-page PDF that details all of the things that.
Yeah, they say all the possibilities, but I was just curious if the town had explored those possibilities, maybe.
Like what specifically they were.
What they
looking
might
for.
specifically to do, and during that exploration, maybe Mike Cahill and the Net Zero Committee can explore it, you know. I know it's a small amount of money, but They seem very passionate about their responsibilities, and it might be something of interest to them.
Okay, thank you.
Is there a motion relative to administrative note number 4?
I'll make a motion that we approve administrative number 4.
Mr. Cohen makes the motion. Is there a second?
Second?
Mr. Canty seconds. Any further discussion? Mr. Cohen?
Yes.
Mr. Quintal?
Yes.
Mr. Canty?
Yes.
Ms. Iaquinto?
Yes.
And myself, yes, it's unanimous. We normally have public comment directly after the administrative notes, but I know our esteemed moderator is here to give us a brief presentation tonight, and he has other commitments. So unless there's objection, and we don't plan to take any votes on anything that the moderator is going to discuss here tonight, unless there's objection from the board, I'd like to let the moderator go ahead with his presentation.
Good evening, and thank you for having me here. This is be brief. It is really dovetails very nicely with the guiding principles that you adopted about 6 months ago. And this is an initiative from the Massachusetts Moderators Association, where I serve on the board, and I attended the annual meeting last month, and they asked that we bring back their initiative for the coming year to each town that has a town meeting. And this initiative has to do with the fact that we're going to be celebrating our semi-quincentennial, the 250th anniversary of the revolution in this country. And the hope is that we can shed light on the need for civil and civic discourse in the country. And we're hoping that it can start right here in towns with town meeting. And Plymouth in particular was spotlighted at this meeting for a number of reasons. First of all, because we're kind of a star insofar as we're the only town meeting town in the Commonwealth that has had a home rule petition for a hybrid town meeting. And I want to thank the Select Board for their support in helping us with that home rule petition and having the hybrid, but also because Plymouth is where it all began. And by that, we know that we have in 1620 the Mayflower Compact. And so the Mayflower Compact really started town meeting form of government and that legislative process, and it is on which many other town meetings are modeled. And I'm not going to read the whole compact, but I want to just read one sentence in the compact for those people that may not be terribly familiar. The Pilgrims at the time said that we covenant and combine ourselves together into a civil body politic for our better ordering and preservation. And so at the time, the Pilgrims knew that it was important to have good public discourse. And that's why they had the Mayflower Compact, and we find ourselves here today. So the Mass Moderators Association also has a committee on which I serve. It is the Spark of the Revolution, and you'll be hearing more about this in the coming year. But we have a mission statement that I've been asked to share with the town. We've all been asked to share it with the various towns. And this is the mission. To better our own capacity and strengthen society and associated civic institutions, using town meeting as an exemplar, a model to model the importance of civic discourse, preserve and promote the principles of local, deliberative, participatory democracy in the present day, drawing from the lessons of American self-governance and its roots in the Commonwealth of Massachusetts. So as we begin our celebrations and observance next month on the 250th anniversary, we're hoping that the town, following the guiding principles adopted by you and by town meeting and the moderator's request for good civic discourse, that we keep that in mind in the coming year. Thank you.
Thank you, Mr. Moderator, and I couldn't agree more with the need for something like this. Is there anything from the board? Ms. Iaquinto?
Thank you so much for that, Mr. Trifoletti. I was just curious, are you looking for action items to support this, or examples, or is this sort of an aspirational statement?
No action item, really. Just we're trying to spread the word that we are promoting and supporting and trying to encourage good civic discourse in town government. We feel that we have some conflicts at the national level. We feel that at the local level, if we can start and show by example that we can all talk civilly to each other and have discussions and then vote on whatever might be before us, that would be good, an example to show the community, to show the Commonwealth, to show the country.
Mr. Cohen?
I couldn't agree more. Thank you for bringing this to our attention, and I know you've been able to reach out to Committee of Precinct Chairs and the legislative body of town meeting of the importance of what you're trying to gain support for, and that is a heightened awareness of the civil body politic and its ability to enter into a discussion. I'm always fascinated by the Mayflower Compact for its reference to we gather into the civic body politic. So I point to that, and I often remark on when John Adams wrote the Massachusetts Constitution, he referenced that statement in the Mayflower Compact. He drove inspiration when writing the Massachusetts Constitution, which later became the United States Constitution. So obviously here in Plymouth, when we gathered into that body politic and we began this debate, it did lead to, and if we're watching Ken Burns's documentary on the Revolution, you see, I thought it was very interesting where he referenced King George outlawing more than one town meeting per town in New England. He was very worried about this body politic debating the issues of the day. So the legislative process of our town has a long 400-year history, but obviously the 250-year history is significant in its inspiration for civil debate and dialogue and testing our temperament for the issues of the day. So thank you for bringing this to our attention in your efforts as the longest-serving moderator in the Commonwealth of Massachusetts, I believe, if that's correct.
One of the longest, but thank you.
One of the longest moderators. So we have that on top of the 250th anniversary. But let us know how we can help in promoting this effort you're involved in. Thank you very much.
Thank you, and I just, again, want to reemphasize, we often forget here in Plymouth that while we're doing our business here in the community, we really are a leader in the Commonwealth, and other towns look to us because of our history going back to the Plymouth, the Mayflower Compact, and so often we're called upon, and I'm pleased that we have an opportunity to show other communities in the Commonwealth that we do things well here.
Thank you, Mr. Moderator.
Thank you.
All right, we'll move back into regular order. Is there anyone in the room who'd like to register a public comment? All right. Did someone raise their hand? Is there anyone online? All right, well, moving along on the agenda. We have a discussion about New Year's Eve extension of hours. Lisa Johnson, I didn't see Lisa in the room. Is Jason, are you going to be presenting?
Yeah, my apologies. Lisa's out with the seasonal flu, so
Oh, no.
I'm
Well, we
second
hope she
best for
feels better.
tonight. Yeah. So for the record, Jason Silva, the Director of Inspectional Services, and I believe your item is the alcohol and beverage licensing extension of hours. It's a traditional request that comes in front of the board, at least to my understanding. It covers about 160 alcohol and beverage licenses in town, or a few more, for one night. It extends the hours to 2 a.m. on January 1st. So if it's the pleasure of the board to vote in affirmative or the denial of that extension.
Thank you. Are there questions from the board?
Motion to approve?
Mr. Quintal has made the motion. Is there a second?
Second?
Mr. Canty seconds. Is there any discussion? Hearing and seeing none. Mr. Cohan?
Yes.
Mr. Quintal?
Yes.
Mr. Canty?
Yes.
Ms. Iaquinto?
Yes.
And myself, yes. Thank you, Mr. Silva, for that very brief presentation and very quick vote. We appreciate it.
Thank you, Mr. Chairman.
Excuse me. We're now joined by the folks from Beth Israel Deaconess Plymouth for some updates about the work that's going on down there. Kevin Coughlin and Erin Yale are here, and I invite them to take the podium.
Good evening. My name is Kevin Coughlin. I am the president of Beth Israel Deaconess Plymouth, and my colleague, Aaron Yale, is the chief operating officer. We appreciate the opportunity to come and update you on the work that we're doing now and the planning that we're doing to ensure we accommodate the community with their healthcare needs. So I'm going to kick things off, but given the fact that I am retiring at the end of March, I'm going to hand it over to Erin, who will be the continuity for the community on the work that we're doing, so she can talk to you specifically about our planning and some of the construction we're doing right now. So this is our mission statement. I'm not going to read it, but I'm going to explain it in Kevin's terms. We are part of an integrated healthcare delivery system, a not-for-profit system here in Massachusetts. Our mission here in Plymouth is to provide all of the healthcare services that the people in this community need. As all of you know from reading the headlines, healthcare, particularly the acute care hospital business, is a very difficult business right now. Almost every hospital in Massachusetts is losing money, which makes the challenge of our system harder, but one that we have to work harder to attain, particularly in a town like Plymouth that is growing as dramatically as it is right now. So we recognize our job is to figure out how to get better and how to build this organization into what it needs to be. So, we're a 15-hospital organization now, Beth Israel Lahey Health, and the larger organization has a strategic plan, which briefly is to do what I just said in all of the communities that we are present, from Exeter, New Hampshire, down here to Plymouth, along the entire coast of Massachusetts, ensure that we are providing the services, the healthcare services that our communities need. When BILH came together in 2019 and they were negotiating with the Commonwealth, our leaders were negotiating with the Commonwealth, a commitment was made to deliver 70% of the care that we deliver as a healthcare organization out in the communities where people live. That is a very different mission than has been the standard in eastern Massachusetts. So what this document outlines is the work that we're doing here in Plymouth to accomplish that promise. So community care expansion, when we merged with BIDMC in 2013, the end of 2013, we immediately started to integrate the clinical services being delivered down here in Plymouth with the academic medical center up in Boston. So the faculty group, BIDMC is part of the Harvard Medical School teaching program. The clinical instructors up in Boston and the leaders of those departments took over most of the care in the hospital that we're delivering right now. So we have integrated all of those services with the academic programs up in Boston. We did that because that quickly enabled us to access the quality and safety programs that were being utilized up at BIDMC. As we grew, so merged in 2013, we were growing starting in about 2014 from 9 to 12% a year over year in volume of patients coming into our organization. Some of that is because of the growth of Plymouth, the growth in the communities, closing of healthcare services in our communities, and just a general need for the types of services that we're providing. That, for anybody that's been in the organization, we quickly became overwhelmed with the space that we had. So we immediately, really starting at the pandemic, started to make capital investments in our infrastructure to accommodate the number of people that were coming in. So what we first did was I believe we're the first hospital in Massachusetts to put in place through the Department of Public Health a prefabricated hospital building. So I'm sure you remember this. We had a building built down in Pennsylvania and trucked up here in 14 trucks and lowered into place. And that is it's an observation unit or a clinical decision unit. It's where people that come to our emergency room that need to be held for a short period of time for either observation or for additional testing can be held in a room with a door with some privacy where they can have their family stay with them. So that was a 25-bed unit that was put in and opened. So we started it in 2020, the planning, and opened it in 2022. By using this prefabricated construction, we cut the time in half from the time we got approval to the time we could open it. The emergency department, Aaron will talk more about this, that is in flight. That's a $50 million investment that we are making. As a not-for-profit, we do raise significant philanthropy throughout the community. Our organization requires, for capital projects, that we raise 20% of the cost of that project in the community that we are in. So 20% of that $50 million, we have raised the majority of it here through people in this community that are invested in the organization. When Compass Medical went bankrupt and closed all of their medical practices across eastern Massachusetts, we started having conversations with some of the leaders in the Middleborough area and heard a lot from patients in that community, mainly because they were coming through our emergency department. So I decided to sign the lease for that space down in Middleborough, their Middleborough space that they vacated, a 30,000 square foot medical office, which we have repopulated with an urgent care center and 16 primary care providers, the majority of whom were working in that office prior to that bankruptcy. We also have subspecialists, orthopedics, cardiology, and endocrinology working in that office as well. As we move through the emergency room project, we also understand that the inpatient bed capacity that we will need for this community over the next 10 to 15 years will have to grow. So if Plymouth is growing at 8% per year, and the surrounding communities are also growing, we're going to have to add over time some additional inpatient hospital beds. We've got plans to start to decant the actual hospital building of services that don't need to be in the hospital and backfill those with beds. So that will get us, we need 55 to 75 new beds over the next 10 years to accommodate this community. That will get us 3/4 of the way there. We will have to figure out how to get those additional beds in. In Massachusetts, it costs between $2 and $3 million per bed to build in an acute care hospital. So that's a tremendous amount of money. You can see in Boston, Mass General and BI both. BI just opened an inpatient building that was $1 billion investment that was made in MGB. At the Mass General site is putting about $2 billion into inpatients. So it's a really expensive thing to do. In a community like this, we're sensitive to the way we spend the money, so we want to be as innovative as possible around that. Quickly, other investments that we are making are primary care, not just in the Middleborough market, but we've tripled the number of primary care physicians that we employ in Plymouth and the surrounding communities over the last 5 years. And back to, that clinical integration that I talked about when we started with the integration with BIDMC. Given the stresses in Boston, in the academic settings, in the lack of space, and given the growth in the population, we recognize we have to start to move more clinical services out of the city down into our communities to deliver that care here. So an example of that Aaron will talk about is the work we're doing on our cancer center, where we're actually partnering with Beth Israel Deaconess Medical Center to build a new cancer center, a new infusion cancer center over at Cordage Park, tripling the size of the center we have right now, and more than tripling our ability to care for patients. So we will continue to make investments like that. I guess the last thing I want to cover is workforce. So, there is clearly a paucity of healthcare workers around the country. It's a little bit worse in Massachusetts because of the cost of living here. What healthcare workers, regardless of what type of worker you are, a doctor, a nurse, a radiology tech, the rates are not radically different around the country in what they get paid, but the cost of living is radically different. So we have significant out-migration of the people that we train here in Massachusetts into other states. So that is something that we are working on with local legislative leaders, Massachusetts, our legislative delegation, and also starting to have conversations with employers and developers also to try and understand, how can we make it a more reasonable place for folks that we need working in our hospital to live. So as we think down the road, that is something that we're going to need to partner with all of you on as well. With that, I will turn it over to Erin to let her, I didn't click through the slides. Talk about our clinical expansion.
Okay, thank you, and good evening. Thank you, Kevin. So I'm just going to take a couple of the topics that Kevin talked about and take them a little further to give you a little bit more information. So we talked about the 70% of care that we're trying to bring into the community, bring that care closer to home. Currently, we're at 55% of that care happening closer to home. And for those of us that take Route 3, we know that that can be difficult, even in good circumstances like going to the Red Sox game or going to the museums. To go when you're not feeling well and to go time and time again is a concerning piece. So whatever we can do to bring that care closer to home, we're all about. The other piece of that is it keeps people at work, it keeps people in school, doesn't become your whole day for your health care. So we've got some strategies to work on that, and that is in new markets, and so we've been in this market, so that one does not necessarily work for Plymouth, but to strengthen, and we're called out on that side as well, and then to enhance our care capabilities and infrastructure. So the health system is very invested with capital commitments, like we talked about with the ED, tell you more about Cordage Park, to ensure that that care can come closer to home. Again, we talked a little bit about this with the Middleborough and where we've been able to go. There are plans to put vascular services there and pulmonary and orthopedics. We go as far south as Sandwich, so we have lab, primary care, OBGYN. We're also going to have cardiology down there in a little bit, and then future orthopedics presence as well. Talk more about our emergency department in a moment and our infusion and cancer services. We've done a lot of business transformation in the past year and a half, working a lot at our system level. So the buying power when you have 15 hospitals, like Kevin talked about, it's amazing. We can work together to buy our filters for our HVAC systems. We can work together on our lab equipment. We just got automation, which is extremely exciting. It actually makes the tests go faster. We're able to get your results to you quicker, and we were able to do that automation because of a bulk buy with a couple other health care entities that are part of Beth Israel Lahey. So not only are we all on the same system and people all are trained on the same system, but that helps us with costly reagents, and actually looking at, as we want to upgrade that technology, we'll be able to go back to Roche, which is our vendor, and do more together. So that's been very exciting to work on. This is a little bit of information on our emergency department. Like Kevin talked about, we're in an emergency department right now that's built to handle 27,000 visits. Right now, we're at about 46,000 visits, and today it's busy, very, very busy in the emergency department. And this starts our viral season, and it will stay that way for the next several months. And then when viral season get through with that, we get our seasonal situation here in Plymouth, and that makes it busy again. So it's always busy in the emergency department. So what are we going to do about that? We are doubling our square footage. We are creating private treatment rooms. So Kevin mentioned that a little bit in our clinical decision unit or observation unit. Right now, we only have 5 private rooms. So if you're being seen, and these are very sensitive things that people are seen in the emergency department for, only 5 people have the ability to be in a private room. When it says 26 bays, at times that's a hallway where you're seen. And of course, the staff is very dignified, and we do everything we can to help, but it's not the same as having your own 4 walls and being able to have your family right there with you. So 37 private treatment rooms will be when we're finished. And then we are seeing an increase in behavioral health, not only for adult patients, but also for adolescent patients. So 16 secure holding behavioral health rooms will accompany our renovation, along with an additional triage room, and then more space for our staff to congregate, to teach, to work together. Right now, they're really on top of each other, so it's something that we're very much looking forward to. So we talked a lot about what this means for private exam space, for capacity for mental health. We will also be updating our patient monitoring equipment, and we will be able to, with all of that, improve our flow and reduce wait times in the emergency room. In fact, one of the things we're trying to do is really not have people wait in the waiting area and really move people back. It's called pool to rooms, and move people back right to the room so that they can have that privacy right away. So more to come with that. This is just a schematic of our future. What this is showing is that there are no more hallway beds and no more curtain bays, and that we've got lots of space to see our patients. Phasing of this as well, and these are the phasing and how long it's going to take. We are actually in phase 1A right now. The good news with phase 1A is in the spring, we'll have 12 new rooms that we could start to see patients in, and those are all private rooms. And again, this is a lot of days. What this translates to is approximately October 31st, 2028, when we'll be done with our construction. Here's some progress on the dirt moving and great things happening. I will say, please go to our website. We do update on this and what's happening as far as our construction. So right now, we're doing some facade work, adding the chiller. So lots of great work happening. The one story I like to tell with it, it's not a long story, is we have construction teams who say, I've been working on projects all over Massachusetts, and now I get to work on one near my home. And people who have had their kids at this hospital, and they're very excited to be able to work on an emergency department that they will use, unfortunately or fortunately in the future, but they feel very close to this project, so it's been great to have that. This is a rendering of what our exterior will look like, with lots of light. Where you see that person walking into the building is really our renovated waiting area. There'll be an area set for adolescents, which will look and feel different than where the adults wait if we do have to, and we cannot pull from the waiting area. So lots of great things to come from there. Another view of our waiting room. Again, the private exam room. What I'd like to show on this is 2 things. One, if you are in that bed, if your head is in that bed, you'll see that you're not seeing all of the medical equipment. So, of course, it's always anxiety-provoking when you're in the emergency department, but we've designed this so that you can focus on your friends and family who are sitting in those chairs, and you will see out to pictures and different things. You won't see all the medical equipment behind you. The other piece with this that I'd like to talk about is that our staff, like Kevin talked about, we included them in the design. We actually mocked up a room in the basement of our hospital and had over 250 Post-it notes where people said, I think this should go here, and this would be better placed here. And we did that with our physicians, our techs, our nurses, our social workers, those who deliver food, those who clean the rooms. So really trying to get what would work. Not sure the architects were so appreciative of all the changes, but it will help us create an even better space for everybody to work in. So involving people in those decisions. Okay. We will head to the Cordage project, which Kevin talked about. This is spring of 2027. What is exciting about the Cordage project is that we are able to grow, as we'll talk about, but it also, back to the emergency department project, it allows us to take the space that we currently have, that we've outgrown for our hematology and oncology patients, and turn that into the locked behavioral space. So as we talked about how we need to grow that for the population, that space will be where our cancer center is now. So here's a rendering of what that looks like at 10 Cordage Park Circle. Again, we're able to integrate, enhance the clinical footprint, and enhance some of the offerings. What I can say about that are a couple of things. First of all, right now, we are at 12 exam rooms. Our physicians each like to have 2 exam rooms, and our advanced practice providers, that helps them go and see patients in a more efficient way. We can't offer that right now. We don't have enough rooms for them. We also have people that want to see more patients, and we don't have the space for them to do so. So we are going to go from 12 rooms to 17 rooms, which will give us a lot more exam room space. And then our infusion bays will grow by 14. So we have 22 now, we'll be up to 36. So definitely improvement in that space. We'll also, in the downstairs piece, have really good space, again, for the clinical teams and all the meetings and the things that we talk about, the collaboration that needs to happen. We don't really have good space for that currently. And improve the patient experience. So a piece with that would be where we are designing our infusion bay. You'll actually look outside and see the bay. It should be a very supportive environment. Right now, there are no windows in our clinic. So it makes it very hard for patients, especially as they have to stay for long infusions. That's Cordage in a nutshell. Spring 2027, and we are on time so far. And in addition to the pieces that we've talked about, we'll also have access to the BIDMC and Leahy clinical trials, and subspecialists who can come as well. So, and then with BILH coming together with Dana-Farber in 2028, that'll lead to more opportunities for our patients as well. Okay. Kevin talked a little bit about this slide. It really is, what else can we do to expand and grow the needs of our community? So nothing really more to say on this slide, except that we continue to innovate and think about what we can do. And not just think about that in our buildings, but actually what we can do virtually and what we can do in the home as well. So a virtual example is our cardiac rehab program. We now offer that in the home, and the equipment is sent to the cardiac rehab participant. They work with the physicians and the cardiac rehab team online, and they're able to, so on a day where it's snowing or raining and they may not want to come in, they're able to get that care. This is also a piece about mobile integrated and hospital at home, where we can offer services to maybe lessen the stay in the hospital, provide follow-up services, and maybe make it where you don't have a readmission, and we're able to bring paramedics and others into the home to help the patient. So more to come on that, but lots of innovation. So really expanding those walls. That's our presentation for this evening.
Thank you. Thank you both for being here. And I see your colleague, Bob Johnson, is also in the audience here. I'd like to recognize him as well. I've toured the hospital a couple of times, both with Bob and with you folks, and it's really impressive, the work that you're doing down there. I was really particularly pleased to see the observation unit and the real impact that can have on your operations down there. So, thank you for that. I think it's also important to say that you guys are making a huge financial investment in the town of Plymouth, not just through facilities, but also an investment in our workforce. You're bringing in the kind of jobs that we want to see here in Plymouth, so thank you for that as well. I know that you folks have also started conversations with the town manager about strategic partnerships that the hospital and the town can undertake in the future through policy and communication work. So I look forward to hearing in a future update how those come to fruition. I'll open it up now to the board. Does anyone have any questions or comments? Mr. Canty?
So the town is currently going through a master planning process, which has revealed a lot about many things about the town, but including our demographics and the shifting demographics that we're having, and how much of Plymouth is aging. Not only its current population, but also a lot of the people. We're gaining about 750 to 1,000 people a year, new residents, and many of them tend to be 55 and over. And I know in one of the earlier slides that Kevin had presented, there was a bullet about expanding at least one practice area. Do you have right now, like, what, is that going to be targeted towards our aging population, or do you not know yet what that specific practice area that you're looking to expand in that way? I just know that that is going to be an increasingly prescient concern for the community as we continue to gain more and more seniors or near seniors.
Yes. Yes, so I can speak to that both personally and professionally. So I moved here, moved my parents here as well, so we're all Plymouth, we all live in Plymouth. So yes, I can speak to that with Plymouth just from my personal experience. So a couple things that Kevin touched on. One is the oncology piece. So we know as people live longer, that oncology is sometimes something that they
Right.
face. So that's really one of the reasons to build it to the level that we're building it at, so we'll have future capacity there. Also with our cardiac programs, which is another area as well. So we do have our cath lab. We are able to treat blockages 24/7, keep a lot of the patients here and not have to go to Boston. So that will be a continuing thing for us as well with cardiac care and cardiac health, also gastroenterology as well. So I think those are three areas that we can say confidently that we're concentrating on. Additionally, with orthopedics, being able to offer, which we are now doing, same-day joint services, so joint repairs, shoulders, knees, hips, another area where we're seeing a lot of growth, somewhat related to an active aging population. Does that answer your question?
It's a good start. I look forward to seeing as that continues to evolve. I know it's going to be, obviously, a lot of health-related issues, unfortunately, are associated with an aging population.
Right.
And it's not just us that's aging too, it's our surrounding communities that are also serviced by your hospital. So I appreciate the efforts that you're undertaking, and I would just encourage further efforts in that regard as the South Shore continues to age. I know that there's a local developer that's working on providing some area housing that's sort of targeted towards some healthcare workers, relatively small project, but a meaningful impact. But have you considered trying to work with the community, the town directly in terms of provide, because obviously if we could, it's a service to Plymouth to have qualified healthcare professionals in the community. And some of your, for example, if a doctor comes in, they might start as an intern, might start as then a resident, they're making a little bit of money, not that much money. If they were living in some partially subsidized housing, they get roots in Plymouth, then when they're a chief resident or an attending, making more money, they might move into a house around here, pay more taxes, and then we would benefit from that in the long term. And obviously the community would benefit from their presence throughout their career. Obviously could apply to other professionals like nurses, PAs, CNAs, of things of that nature. But has there been conversations, I know there's talks about strategic partnerships with the town, but that's one in particular, because we're having part of that master plan process is that affordability is the chief issue in the community right now. And although people think that people in healthcare make a lot of money, there's a lot of people in healthcare that don't make a lot of money. I'm the son of a nurse, and she, later in her career, made a lot of money because she was in the field for over 30 years. But when she was working at like Huntington General, which doesn't even exist anymore up in Boston, not that much money. So has there been those types of conversations about trying to make it easier to be a healthcare professional in your hospital through those types of partnerships? Or would you be interested in having those conversations if there haven't been?
So yes, yes, and yes. So we started to work with that developer. He contacted Kevin, and then I worked with him as well. Really wonderful to speak to him. And we talked about sort of what he's planning to do. And then we brought a focus group together of healthcare workers. We actually chose our travelers. So because we know that they are here for a long time.
Right.
At times, they need housing. And I'm happy to share with your team the information that we did put together for him. He was interested in what his affordable housing was. It's really to your point, and what our healthcare team said was affordable housing were two different points.
Right.
So we talked about that. We talked about what people are looking for, especially as they're new or starting out in their career. And it was very interesting. They want their own bedrooms, they want their own bathrooms,
Right.
but common space, kitchens, things like that, they're happy to share. So it's a very different model than maybe what some of us looked for in our first places. They're
Right.
very into community space. They may not want cars, they might want to bike or e-bike or things like that. So we did work with him and provided him probably about 26 people who did a focus group, and we were able to give him that information. He came to the focus group. Some of them actually were there, others did it by survey. So we will continue to work on that with our teams and figure that out. That is a big piece that we hear is housing.
Yep.
So, yes.
So we'll, one of the reasons that
If you could take the
Come on back
microphone.
up to the microphone, please.
I've actually asked Derek to come to our board meeting in January so that we can start to have these conversations. So, I've been, on me, I have been delayed in getting him into our organization to really start to partner and think about how we can do a better job working with the town as we both move forward with some pretty significant challenges. But when he comes in, one of the things we will talk about is, what are the ways that we can partner with the planning processes that are going on in Plymouth, and what are the ways that we can partner with you on creating opportunities to get new people in. We're hiring 500 or 600 people a year,
Right.
new,
Right.
and most of them can't afford to live as close to
Right.
the hospital as they
Right.
would like. So very early in the process, but very open to partnering with you and the rest of the town in any way that we can to really think about these challenges that we have going forward. We've got a pretty innovative organization as well, so.
Yeah, and I know from my family experience, I mean, my mother lived down here, but commuted to
Right.
primarily to Spalding Rehab because Jordan at the time
Yeah.
didn't pay a rate that she could afford to, like many residents, she could afford to live here, but only by working elsewhere.
Yeah.
And that, she worked in that job commuting like 3 a.m. to beat the traffic for 25 years. But a lot of people these days, if they have to commute to BID Plymouth, as soon as they find a job closer, they're going to leave. And then you have to onboard somebody else, that churn, and that increases your operational costs,
Right.
lowers patient care, and, just creates a bad situation for everybody.
Right, absolutely, agree.
So-
So yes, we're very, very interested in partnering with the town and the business professionals in the town to think about how we can solve some of these problems.
Yes, and I think that it would be worthwhile, there would be a significant community benefit in a way that with many other private employers, there isn't.
Correct.
For us to partner because of the nature of what you're providing to not only this community, but to our surrounding communities as well.
Right, I mean, and selfishly, from our standpoint, it provides a stickiness for those employees.
Correct.
It's, healthcare workers are a commodity right now, they can move around. And
Right.
there are plenty of places within 30 miles of here that they can go.
Exactly, and once they've settled roots down somewhere, they're
Right.
less likely to leave. And then, as I said earlier, if they do get to that point in their career where they are making more money and they want to live in their own, outside of they get tired of sharing that communal kitchen.
Right.
And they want to buy their own single-family home, then it's a different situation. But, we get the benefit while they're being subsidized, to speak, but also we get the long-term benefits as well. So,
Yeah, agree. Thank you.
thank you.
Mr. Cohen?
Yes, thank you very much. That's a very helpful presentation, obviously very educational. We're all very interested in the hospital here in Plymouth. Obviously, it has a long history. Plymouth has a history, but the history of Plymouth and its commitment to medical care at that location is something that we have to be very, very focused in supporting in any way we can, whether it's the employees or it's the hospital itself. It's one of the greatest assets the town of Plymouth has. So we appreciate that, your commitment to the care and well-being of people not only in Plymouth, but regionally. Like, you know, we are obviously, there's not much between Boston, the South Shore Hospital and the Cape. So we're lucky to have you in our community. So whatever we can do, please keep us informed and work with town staff and with the community to maximize that. But I do want to make note of that you're in a very unique location. You're in Oberry Heights. You're in a neighborhood. There's residents. We all know the residents, and another compliment is how much you work with those residents to make them part of the process. It's kind of a unique situation where the hospital is right in a residential area. So over the years, I've watched your overtures to your neighbors and your abutters, making sure that they were heard, and because they want to support you as much as they can. And finally, obviously, in your renovations to the building, there's different memorials to different people, and I'm sure you're taking the time to keep track of those. I've been noticing some of the historical materials you've been moving around the building on different walls, which is great for people visiting the hospital to know the story of the hospital. I do note that to the right of the emergency room expansion towards the 1968 edition there's a, by the way, I'm like one of the only guys that like brutalism. I think it's, I'm fascinated by it. I have no problem with it.
We're trying to restore it.
I know, everyone's painting it, doing a different thing, just let it be brutal. There's a little birdhouse there, and there's a little tree. It's kind of a Charlie Brown tree that a former select board member here, Dr. David Rushforth, took care of in the little tree. I see that you're taking the time to make sure that the construction doesn't get in close proximity of this birdhouse and tree, so thank you very much for that consideration.
Mr. Quintel?
Yeah, I just want to say that this whole presentation and all came to from the meeting that Mr. Johnson and I had, and we started talking and going over the plans, and I said, you really need to come into the town and let the townspeople know what's going on, because you see all the time is, you know, we get blamed for everything anyway, but, you know, the expansion and the weight, and, you know, that's why I felt it very important to explain it to the citizens in the community, the residents. And it's not just our community that's growing, Carver's growing, I mean, Kingston, I mean, they all come to Plymouth. And I have a long history there. I worked there in the cafeteria under Judy Lagoa many years ago. Mr. Chapman was running the establishment. I got an award from the hospital in 1978 for the blizzard, because my family has a produce business, and we showed up during the blizzard for the hospital, and they really made a bit, you know, to me it was just, my father's like, get over there. All right. But it was nice, and a little more history. I had a fast ticker one night, so I was on one of the floors there, and I looked out the window, and I said to the nurse, I go, geez, isn't this funny? I said, I was actually born in the old section right there, and here I am tonight in this room with my ticker going. I said, you know, I'm not going to tell you how many years ago it was, but it was a while. So I'm glad that you came in for the presentation. I hope the town works well with you. I'm sure they will. And let's keep the communication open for everybody involved.
Really appreciate, I guess instigating us to come in. And, you know, in hindsight, it's been a missed opportunity that we hadn't done this earlier, and it will definitely be something that we're going to do regularly going forward. So appreciate it.
Mr. Johnson, to you, I would like to be in touch with you this week, because our family is going to make a sizable donation to the BID, as I told you we would. So I'm sure. Thank you.
Thank you very much.
Ms. Iaquinto?
Well, I can't top that one, Mr. Quintel, but I would add my thanks to Kevin and Aaron for this really informative presentation. I've had some personal experiences with the facility and your staff that were all nothing but positive, so thank you for that. And I know that the community, most people in America right now are very concerned about the cost and quality of care. And I think that the plans that you outlined here really, really do a really great job of addressing both of those issues. I did have a question about primary care, though, because primary care providers are like unicorns these days. And I know that this isn't just a Plymouth problem, it's a United States problem, it's a national problem. But what, if anything, is the industry doing in general, or can BI do specifically to improve the primary care options that are available to all of us?
Huge problem. And look, the reality is that being a primary care physician or an advanced practitioner in primary care is an extremely difficult job. They are the gatekeepers for all of the healthcare, and it's almost an unmanageable situation right now. So a couple of things that we are doing to try and improve that. First, we have for all 15 hospitals, we have one primary care group that everybody now is employed through. Same folks that have been here all along, but through a different management structure. That group is managed by physicians, and it's structured in a way where the individual primary care providers get a very, very strong voice in not only how their practices are run, but how the overall organization is run. And BILH as a system is very responsive to them. So we actually, unlike most organizations in Massachusetts, we have been attracting large numbers of primary care providers into our system because of that. You know, whether it's nurses, techs, or physicians, one of the most frustrating things for them is to not feel like they have a voice in the decision-making that's going on around them that impacts the way they take care of their patients. So that's the first thing that we did, and it's been very successful, and it will continue to be. The other thing is we're investing heavily in artificial intelligence, in enabling, I'll give you an example. We're using this in our emergency room right now. We have an AI tool called Heidi, which is partnering with our electronic medical record, and the physician has a recording device or their phone, and will say to the patient, are you okay if I utilize this AI tool to record our visit? And what it does is it's smart enough to listen to a regular conversation, pull the important components of that conversation out, and populate the electronic medical record. So one of the biggest frustrations for nurses and doctors is that they spend most of their time staring at a computer screen, putting the information into that electronic medical record that they just heard from the patient. What's the most satisfying thing for a doctor or for a nurse is to be able to be at the bedside with that patient, looking at them in the face and having a conversation with them. So those two things are dramatically changing. We're hearing it from our providers, dramatically changing the experience that they're having. We're in the beta phase of that right now. By summer, we'll be rolling that out to all of our providers. So I think those two things quickly will make a big difference. And then, I mean, look, our system's so broken, the way we reimburse, the way a doctor gets paid for what they do, there's great disparity in the investment in time that a physician has to make, depending upon what their specialty is. They can invest little time. I'm not going to pick on orthopedic surgeons, but they're an easy target. So an orthopedic surgeon will spend 10 minutes with you and get paid $350 for that visit. A primary care doctor will spend a half hour or 45 minutes with you and get paid half of that, right? So if you think about those economics and then the time investment, it just makes it, the way our healthcare system is structured, makes it really difficult. It's why there aren't very many private doctors anymore. It's why we subsidize the physicians. So that problem, that's a bigger problem that's going to have to get worked on. But it is the issue we think about every single day. And to the question of, are we going to be able to take care of all the patients that are in the community with the specialists? That we think about every single week. We're thinking about, what specialists do we need? Where can we put them? And how do we recruit them? So we constantly are recruiting for probably between 5 and 10 different physician specialties down here now. So.
That's great, thank you so, that was very encouraging.
Mr. Quintel?
Just, listening and sitting here thinking, and I heard you say earlier that if they're struggling, not making money, and you hear this all over, even physician fees. And it brings me to this one. Our medical bill for our medical insurance in this community for 1 year just rose $4.5 million.
Yeah.
And everybody's insurance, whether it's down or not, is seeing these increases. So I guess the question is, with the amount of fees they're charging for the medical insurance, apparently they're not paying the hospitals or the institutions enough. They're not paying the doctors really enough. So where's the 4.5 million go on behalf of this town? That's just the increase. That isn't the total premium.
So we're a self-insured organization. Our premiums.
As are we.
Our premiums went up 30% this year, so I know what you're talking
30,
about.
yeah.
It's a long conversation to have, but I guess what I'll say is the insurance companies are losing tens of millions of dollars. The hospitals are losing tens to hundreds of millions of dollars. The way we are structured, the way our healthcare system is structured, doesn't work. If there were an easy answer to fixing that, then it would be fixed. But we live in this country when somebody wants healthcare, a type of healthcare, they usually get it. A test, a surgery, a procedure. The industries that support healthcare, that build devices, that make medications, that build the machines that we use, the implants that we put in people, they are constantly innovating and constantly adding to those things, to the options, right? So the number of things, the number of widgets that can be provided to somebody that needs care is growing exponentially, and so the cost goes with that, right? So you don't put a governor switch on, and things are just going to keep getting more and more expensive. So you guys are politicians. I'll let you figure out how to fix that.
I think that's a problem for another level of government. Anything else from the board? Well, thank you folks for being here. We appreciate it, and hopefully we'll see you again sometime after the new year. Moving on in the agenda, we have the Plymouth Housing Resource Center project. We're joined by Jonathan Lanham from Father Bill's in Mainspring and others.
Hello, I'm John Yazwinski. I'm the CEO of Father Bill's in Mainspring. John Lanham was with me here, our COO. We appreciate a few minutes tonight to speak to you about a potential project. So if you're not aware of Father Bill's in Mainspring, to know that we are a regional homeless and housing provider. We shelter over 120 families a night throughout the southern Mass. We have over 800 units of supportive housing, either we own or operate, and we also shelter over 300 individuals. We've been here in Plymouth back since 2005 in partnership with the Plymouth Task Force to End Homelessness, a great organization. Over those years, those first years as a task force, really provided the support of the overnights of hospitality, which is the winter shelter program here in Plymouth for homeless individuals. They rotate from the different church groups. It's just a winter program, as you know, that opens the weekend of Thanksgiving and goes through beginning of April. We've been able to, since 2005, create about 90 units of scattered site housing in Plymouth for formerly homeless individuals that have been outside on the streets here or that were using the overnights. In 2015, we started a more active role with the task force to start to run the operations of the overnights with the churches and the task force. It allowed the task force really to focus on the volunteerism. We were able to bring in our professional staff. It's been a great partnership together to continue the overnights. So over the last several years, Father Bill's in Mainspring has been converting our individual shelters in Brockton and in Quincy to be housing resource centers. So what happens now across the Commonwealth and what happens in Plymouth when the overnights is open is the state really looks at funding shelters at night. And then people have to leave during the daytime and they kind of fend for themselves. We've been able to create in Quincy and Brockton convert to a housing resource center that is 24/7. It still provides emergency shelter, but it also provides wraparound services during the daytime. It gives people an opportunity to stay, and we really can focus on not just the immediate homeless issue, but we can also focus on prevention. It gives people, we call it a resource center, so people come to us before they're ending up being homeless. We've also in these centers been able to create healthcare clinics. It keeps people out of the conversation about medical care. It keeps people, a lot of times, are using the emergency rooms if they're experiencing homelessness and maybe they shouldn't need to be there. We've been able to bring in the healthcare providers to be on site into our places, so it's a win-win for everyone there. What we're proposing and what we're looking to do in Plymouth here is to take a scaled-down version of what we've done in Quincy and Brockton and to have a housing resource center here in Plymouth that would be year-round, that would provide emergency shelter, about 30 beds for the homeless individuals, so they have a place to go, not just for the winter time and not just during the nighttime. What we're also proposing is, which we've done before, is within that same facility is to develop 16 units of supportive housing, efficiency apartments that would really target that chronic homeless group. People that have been homeless for multiple years, really struggling, so it's not really geared for the person that maybe just needs the shelter temporarily, get some employment help, get some services. It's people maybe that we all see in the Plymouth community that maybe struggle with a lot of other disabilities like mental health and different things like that. We have had a great partnership with the First Baptist Church. They've been one of the major sites here in Plymouth to do the overnights. And so we have been talking to them for a while about, hey, could we purchase your property? You've been and you could keep your church, and we'd lease back the church to them in perpetuity, as long as they were around. And then they could take the acquisition money and fix up their church, capital improvements and life and safety improvements. And then we would be able to take part of that land that we would buy and to develop a housing resource center facility. So in your packet, it's a brief write-up, but you will see in there the site plan. You will see the existing site plan that's there now with the church. And then you'll see, so that's kind of what the church is now. If you go to the next site plan, you'll be able to see there. The church is the existing brick building, and then you can see where Father Bill's in Mainspring would be putting our building, would be on the back side of the lot if you're familiar with the First Baptist parcel, and you would have plenty of parking. That's all there also. So we are, right now, have a, also in that building, you see there's floor plans, so you can see the floor plans of the resource center, the different dorm rooms. You would have a medical space there. You'd have a commercial kitchen. We'd really need the volunteers, especially from the task force, to continue to support and help us. And then you'd have efficiency apartments, and so you can start to see what those would look like. I'm sorry for the small scale, but they're efficiency units. They basically are, well, a little over 300 square feet. They're just for an individual, and it's supportive housing. So we would have staff there 24/7. Each person would have a lease, and that, not in the shelter component, but the permanent housing. They would pay 30% of their income towards the rent, which is good. It starts to build up their housing history, so then they can move on, hopefully, too. It comes with a full bathroom, and it comes with a kitchenette and a large room. And so it's a good start for somebody that has maybe been struggling on the streets of Plymouth or in our shelters here. We do have a PNS with the church, where we just found out last Wednesday before Thanksgiving that the state approved our pre-application and is letting us now apply for a full application to help us with the capital costs. Father Bills of Main Street will have to raise significant money. You can see the budget here of over $4 million. But we've been managing this issue as a community. I can't say enough of the leaders here. Well, when we've been trying to do it in the churches and working with public safety and everybody in the town, the police, fire, and everybody's been wonderful through the years with us and the task force, of course. So we are excited about the opportunity to apply to the state. Like I said, we just did 2 large projects over the last 3 years, so we have a good track record with the state. Our project in Quincy was about $23 million. It was a much larger facility. It was 30 units of housing, so it was a smaller scale. About 130 bed shelter. This is a 30 bed. It's 16 units. In the sense of the housing and the shelter. In Brockton, same thing. It was about a $20 million project. The state was able to help it. We also did capital campaigns. So we feel like this is the right model. It will really help the downtown when people aren't like just showing the door in the morning, or when you don't have a shelter, they're roaming the community, all during the months that the shelter is not open. So we're moving towards an application for the state. And we wanted to just come and let you know about the potential of this project, answer any questions, of course, as we go through the process. And we also are looking to see if our application is due December 18th, and we would just love to see if there's any opportunity where the select board would consider a support letter for our application, saying that the community is supportive of trying to help our homeless fellow citizens here in Plymouth. So that's really just kind of the big snapshot. We really know that this, we've seen about any give and take, with a shelter, it averages around 25 to 30 people a night the last several years. Homelessness is on the rise. Housing, of course, we've all talked about the needs there. We're going to keep seeing those needs. Tourism is huge here in Plymouth, so the ability for us to get ahead of it right now and get a shelter here, but a resource center that also focuses on preventing, diverting, and rapidly rehousing people as quick as possible. So it's best practices. It's not just about the shelter. It is about the housing. The other piece is the 16 units of housing would be able to be counted towards Plymouth's affordable housing chart that you report. So it would help the town that way, too. Again, we really appreciate just the opportunity and the support through the years to help people that are struggling with homelessness. So, I don't know if there's anything else I might have.
The only other thing I'd mention, just quickly, just on the shelter dorm space.
If you could just talk right into the microphone.
Sorry about that. With the shelter dorm space, we really are trying to make it a peaceful, restful space for the guests who are coming in. So we do build, we have lockers for all the guests to be able to store their belongings, charging stations for phones or electronics that they have. There's small kind of cubicle walls that go around the bed, so it provides a little bit of privacy. If you've seen some of the other kind of evening shelters, they're often like big, large auditorium rooms with bunk beds. It's not a lot of privacy, not a lot of dignity, so we really are trying to build that into the design of the space. We've used that in our other housing resource centers. That's worked out really well with being able to monitor the space, but also provide that dignity for the individuals who are in the building.
Thank you. So I just want to say I appreciate you folks coming here tonight. I know my former colleague, Mr. Charlie Bletzer, has really been working hard with you folks during his time on the board and after to get you folks the support you need in Plymouth. And, I'll say I first encountered your organization when I worked at Stonehill College. And you're a wonderful mission-driven organization that touches the lives of scores of people, not just the folks who access your services, but the volunteers who make up the core of your operation. So, I'm very supportive and would love to do anything we can to help actualize this project. So I'll open it up to the board for any questions that folks may have. Mr. Canty?
Thank you. So my law office is in Brockton, so I'm very familiar with your presence in Brockton over the years and how that has grown, and I think it's had a significant positive impact there. I'm also familiar with the overnight system we've had here for a number of years. I know that that's heavily utilized, and we're in the process of building a shelter already. I know there's scattered sites which are different, but
Yeah.
I do think it's something that there's definitely a demonstrated need in this area. And unlike currently Brockton and Quincy, right now there is definitely a gap down here for this type of a service, and I think it will be very heavily utilized. Do you have a sense, though, of, in terms of the apartments, so you're in the 30% AMI apartment, is there a goal of how long the typical resident would stay until they moved on to other housing, or would it be up to them and there's no pressure to move forward, or could you just expand on sort of the model there?
Yeah, you're right. It would be 0 to 30% median income. There would be a tenant selection plan. It's probably, in a sense, with the state, that would start with local homeless people.
Right.
We're targeting our most disabled, our chronic homeless group. So there won't be a time limit to the housing side of this. It's not transitional, it's permanent.
Yep.
But we really provide, it's called supportive housing, because
Yes.
what we want to do is they'll all have a caseworker where we're trying to move them on. I would say that for somebody maybe that has been struggling in Plymouth for homelessness for multiple years, they might be there for 3 or 4 years, and then hopefully we're able to move them on from there. And we want to move people on. We want to see them move up into their more market rate or other affordable housing, or elders are a big growing population for us. So a lot of times we can be the first stop, and then we can get them in somewhere else. Veterans are another group that if we get the homeless veteran in, we see them move on pretty quickly. So some groups will move 6 months, a year. Some groups might stay for a few years. We look at it as we don't want to set somebody up to fail.
Right.
If they're doing well there, we don't want them to be the next night at the doorway of the shelter. So
Right.
it is a little bit of working together and working with them on their goals.
Okay. And you mentioned that those individuals would have a lease.
Yes.
What is are they month-to-month leases?
It's a yearly lease.
A yearly
It will be
lease?
project-based vouchers.
Okay.
Mass rental vouchers. So just like any housing authority, they'll have to go through the, onboarding process there with the paperwork and everything like that. And that's really where we're expecting them to be good neighbors, and I think that's what the whole goal is here.
Right. Okay. No, thank you very much. I appreciate that. Thank you.
Ms. Iaquinto?
Thank you very much for this presentation and the overview of what you guys are planning. I am extremely supportive of any resource, any model that is going to help people move towards self-sufficiency, and especially the way you've described it is they're moving on their own timeline, not on some pre-prescribed timeline. So that's another plus in my book. I did just have a couple of general questions, though. I'm just curious, do you have any sense of the homeless population in Plymouth, the quantity of folks that could potentially take advantage of this?
So we know right now, when we do the overnights, it's usually 20 to 25 people that are using it pretty regularly. And then we know we've got about 15 to 20 more people any point in time that's outside. So we know that number's been in about 40 to 50 people at any one time. Now that number, unduplicated, of course, would change maybe several times, 5 to 6 to 7 times in a year, in a sense of how many unduplicated. But at any one time, it's been, right now, we've got about, in Plymouth, Plymouth town, about 40 plus people that are experiencing individual homelessness.
So this project alone would help a good
This would
proportion
be a
of those
huge, yeah,
folks.
knowing that we're seeing the increases. Father Bill's in Mainspring, we've seen a 30% increase in homelessness the last 2 years, which matches with every community. Doesn't matter if it's urban, suburban, or rural. You know, like Greenfield, Massachusetts has got a homeless problem. Portland, Maine has a homeless problem. We're seeing it in every setting. Housing is the number one issue here. So, but providing what we really don't want it to, it's a shelter, but we want it to be like a medical emergency room. We want to reduce the length of stays and get people into the programs that they need to get into. If that's rest homes, if that's treatment programs, mental health facilities, whatever that means. If we can get them into our units and get them assessed, triaged, just like you do in the emergency room, and then move them on, the housing we're targeting, so, you know, if somebody comes in and they're working and they experience homelessness, which we have a lot of people working, we're not going to target them for those 16 units. We're going to help them move on. We're going to help them with first, last, and security. Let's help you with an employment specialist. Let's go back to the private market. Somebody maybe that is out here struggling every day, long time, that's the group that we want to, that can really help the community and the downtown businesses especially.
That's great. I just have one final question, and that is around transportation. Is there a transportation strategy to help these folks get around, or?
So one of the things we do, one is we're going to a site that is already serving them, right?
Right.
So, but we will, and we do it at other sites, we will provide our own little shuttle service that would go to some of the key areas for them to get to. And we have volunteers that will help us too. But right now we'll build in kind of a, you know, maybe they'll hit 3 or 4 spots. You know, our hope is that the day programming really brings a lot of other resources and a lot of other nonprofit or for-profit groups to come in and help us. If we have a facility, we can do job fairs. If we have a facility, we can do healthcare. If we have a facility, we can bring other groups in, like adult basic ed or whatever it might be.
That's great. Thank you. You have my support.
It is
Mr.
on the
Quintal?
Gatra line as well, so.
Will some of these units be as affordable to the town's housing count?
All 16 would count.
16 will?
Yeah.
Okay, I support it also, but thank you.
Mr. Cohen?
Yes, thank you very much. And Father Bill out of Quincy, Mainspring out of Brockton, a number of us are very familiar with the work in both cities. But I always have to think back to the Task Force to End Homelessness, an organization that was made up of volunteers and residents here in the town of Plymouth. They formed 20 years ago after a tragic incident with a homeless person being killed accidentally when he was trying to seek shelter during a storm. And that brought together a number of leaders in our community, within the community, to start up the Task Force to End Homelessness. And obviously, that's where the roots and the taproot of this organization came from. I know how much they have worked with all the different churches in Plymouth, specifically with the Baptist in coming to a conclusion of how best to utilize the site. So I was glad to see that they were working with Father Bill's in Mainspring in bringing that forward. Obviously, your connection to federal and state resources to leverage what we have here locally in terms of sweat equity and passion and volunteerism can be turned into a project of this magnitude. So I always get a kind of a interesting thought about this location. It was part of a farm called Hillside, owned by the Watson family, who was active in the Transcendentalist movement, who led to the gift of Morton Park to the town of Plymouth. Even though a highway sits between you and Morton Park, at one time you were connected to it. So as you move forward on this project, you know, it's interesting to know where this land came from and the passion the Baptists have brought to this commitment to continuing their work on a multitude of levels. I look at the land around it on that hillside, and it was once a farm, so hopefully you can put some community, you know, some gardens around there. Some of the people can grow on that hill there because it gets good light throughout the year. So congratulations on your efforts with the Baptist Church and the Task Force to End Homelessness here in Plymouth. So very, very supportive of your efforts. So continue your good work. Thank you.
Thank you very much.
Is there a motion from the board?
Make a motion to support make a motion to draft a letter in support of their application to
Executive Office of Housing and Livable Communities.
Executive Office of Housing and Livable Communities.
Second?
Mr. Cohen makes the motion, Mr. Quintel seconds. Is there discussion? Mr. Canty?
So I was heartened to hear we were building a family-oriented shelter not that long ago, and that's coming along well. And I think this is another step in the right direction. I hope that this will not be the only shelter. I know Father Bill in Mainspring has a number of operations in Brockton, Quincy, and elsewhere. And I think that we certainly have the population, we're only getting more of a population, that could benefit from even more than this, but this is certainly a step in the right direction. I know that when that family shelter was constructed, there were some people that were opposed to it. I think often there is often opposition to this type of development because of a lot of biases that people have about the people that use your services. But I just think it's important to note that, homelessness is not a moral failing. That in a country where many Americans are $400 away from bankruptcy at any given time, an unanticipated expense of $400 or more would wipe out all of the money that they have in terms of liquid assets. There's a lot of people that are a lot closer to needing the services that your organization provides that they'd like to admit. Yes, there are people that are mentally ill or substance use involved that have to avail themselves of homeless services, and that is a component of what you do, and I know you do a good job in trying to address those. But there's a lot more people than you think that need this at some point in their lives, sometimes for short term, sometimes for a longer term, and those people are just as deserving of support as anyone else in the community. So thank you for doing what you can. I know that there's always more need than you can provide, and that you're always you're meeting the need from probably 18 months ago, and by the time this is built, you'll probably need to already be starting on the new thing if you're going to be able to keep up, and you're shoveling against the tide, but I appreciate you doing the yeoman's work. And
I
doing
think
what
one
you
of the
can.
things we'll look at trying to build upon here will not hopefully be adding more shelters, adding more supportive housing. If the shelter or the Housing Resource Center can, like I said, be that emergency housing and try to then rapidly move people into the appropriate care.
Yes.
So we need to focus, not just us, but communities, we need to focus on mixed income housing, as we've all talked
Right.
about. And
Right.
we need to make sure that that 0 to 30%, 0 to 50% is part of the conversation.
Yes.
Father Bill's in Mainspring, our 800 units, it's all just for 0 to 30.
Yes.
So we say this is what our role will be in the communities that we serve. And we look how can we continue to do appropriate projects, in the community like Plymouth that could be more supportive housing.
Yes, and I think, for many years, Plymouth had a homeless population but no shelters, and we were burdening the social safety net without really contributing to it. And one of the complaints that was received about the family shelter was, well, not all the people that are going to be here are previously Plymouth residents. But that's not how social safety nets work. And for many years, when we had no shelters, we were putting our homeless individuals that were Plymouth residents, considered themselves to be Plymouth residents, in other communities. And some other communities will be putting people here, but that's how it works.
Yeah.
And you have to be part of that fabric.
Yep.
And be there for people that need you, because you never know.
We
So-
need all communities to take some responsibility.
Correct,
Yeah.
and I'm glad to see that Plymouth is starting to do its part in a more proactive way. And again, I appreciate the efforts of Father Bill in Mainspring
Thank you.
to address this need throughout the Commonwealth. Thank you.
Thank you.
Other discussion? Mr. Cohen?
Just a note, it's important to note that they are operating at this location, so that obviously it's a tested location in terms of its functionality. Yes, Mr. Canty's right, sometimes there might be opposition to the idea of affordable housing, but I I believe that sometimes when you have an opportunity to work with the community and have a relationship with the neighborhood all pre-existing, it's only something we can build on. We've seen that happen in other parts of Plymouth. But obviously, we always have to be attentive to constantly reaching out to the residents and educating the importance of affordable housing in the different forms it comes in. Thank you.
Any further discussion? Hearing and seeing none, I'll call the roll. Ms. Iaquinto?
Yes.
Mr. Canty?
Yes.
Mr. Quintel?
Yes.
Mr. Cohan?
Yes.
And myself, yes. We'll get that letter of support over to you folks. Jade can help coordinate that for you.
Thank you.
Thank you so much for being here.
Thank you.
Okay. We have a number of committee appointments to do here tonight. The first is the Plymouth Airport Community Advisory Committee. We have 3 applicants. I'll take them in the order that they're listed on the agenda. The first applicant is James Latimer Buckley. Is Mr. Buckley present? Come on up to the microphone, introduce yourself. Given our appointment process from last week, I would advise that you give a brief remark about why you're interested in the community, in the committee.
Oh, hi, my name is Jim Buckley. I guess the first up. It's my first time even volunteering or being an applicant for any committee position or an advisory position. As I said in my application, I think it's outlined there. I have really nothing more to add to that other than this is something I think my background in STEM, data analysis, I could lend a hand. I've been a resident. I've been in the flight path in the 40 years or plus years I've lived in Plymouth. I think it's about time I contributed something back in any aspect whatsoever. I'm interested in making sure that the area keeps with its long history, its culture, but at the same time, we have to recognize that the progress needs to be made. And I'd just like to contribute and see if I could keep it in the middle,
Excellent.
if that's a summary. It's short.
Thank you, Mr. Buckley. That was a perfect time. Any questions? Mr. Canty?
So I have 2 questions for you and for your competition, I suppose, as well, but you're up first. Do you currently have an opinion on the operations of the Plymouth Airport?
I'd say overall, in the 40 years I've lived in the area, it's expanded quite quickly. I've heard discussions, and I question the terminology used only because, 1, I'm naive. 2, I still know the King's English. I think I know the difference between a municipal airport and a regional airport. I've heard it claimed to some people saying it's a regional airport now. I don't think that's necessarily the case. I've heard experts at the last meeting I was here concerning the airport. I think they were accurate. I respect their judgment. I certainly respected their professionalism. My background initially is my undergrad degree was marine biology. I studied life sciences, and I participated as a biologist professionally with the state for a few years. I moved on to other more technical endeavors. I have an opinion. I think my opinion is we need it. It forms the fabric of the town. It has been since I've been here. I try to keep an open mind on it. I consider myself, I think, middle of the road when it comes to exploring all opinions. Do I have an opinion? I live, less than a mile away.
Mm-hmm.
I hear it all the time. If I were to cast an opinion, I think having the state police there is probably, to me, I don't live in the flight path, say some of my neighbors might. For me, they're the most annoying, but it's a necessary. You can't, where else are they going to go? They can go to
Right.
Marshfield, but their facilities here are quite good. We heard some discussions about the need for more medical facilities. That could be an expansion area. Looking at the airport to be able to support the hospital in the area. That might be a way of, I don't know. I'm speaking out of turn.
That's okay. I did ask you a question, so. Is there anything, my second question, is there anything that, if you were to be appointed, is there anything that the committee is currently doing that you'd like to see them continue doing? Or anything that they're not doing that you'd like to see them start doing?
Honestly, I'm a newbie. So I don't think I'm really that up on I haven't been following it, I haven't been studying it enough. I'm really there to try and learn as much as I can and contribute with my own personal expertise in some science and background in primarily statistics analysis. I'd say no, I don't have a recommendation in either direction.
Okay, thank you.
Sure.
Ms. Iaquinto?
Thank you so much, Mr. Buckley. You have two very nice letters of recommendation in your package, too, so.
Well, they're kind of related as in-laws.
I just have one question. Have you had an opportunity to attend any of the committee meetings yet?
No, I have not, other than listening to the testimony here as one of the select board meetings.
Okay, great, thank you.
Other questions? Thank you very much.
Thanks. Thank you.
Our next applicant is Matthew James Quinn. Is Mr. Quinn in the room? Is Mr. Quinn online? Excellent. Mr. Quinn, we are admitting you into the room. You have been admitted. Please unmute yourself and introduce yourself. And again, please give a brief statement as to why you would like to be on this committee.
Good evening, everybody. My name is Matthew James Quinn. Can you hear me?
Yes.
All right. I have been working for Boston Medflight for 10 years at the airport. So I'm right there at runway 24 and see what goes on. I do enjoy that. The airport's nice and quiet and quaint. I do have some questions when it's expanding, and I think it's just a safety zone, so there shouldn't be any more larger aircraft coming on and landing and taking off. I am a resident of Plymouth with two kids in the school systems and stuff like that. My history for employment is mostly healthcare, emergency medical healthcare. So I wouldn't really have a lot of other aspects, but I am familiar with other airports and cars. Any questions, comments, concerns?
Thank you. Mr. Canty, I believe you have two questions.
I do. Mr. Quinn, do you currently have an opinion on the operations of the Plymouth Airport?
I mean, it closes down pretty much at like 10 o'clock, right? There's no fuel or refueling stations. So I don't think there'll be a lot of night operations unless that changes. No aircraft traffic control. But yeah, I mean, it is a nice, I mean, it has plain Janes there, and it's well run, I would say. My concerns would be if there was like a shipping company, maybe like an Amazon coming in and landing, if that would create a lot of traffic, I guess, going to their hub in Kingston. But
Okay.
other than that, I think it's pretty well ran.
Okay. And second, is there anything that the committee is currently doing that if you were to be appointed, you'd like to see them continue doing? Or anything that they're not currently doing that you'd like to see them start doing if you were to be appointed?
That was a good question. I don't, honestly, I'm ignorant to what the committee is doing. I mean, the information is out there. You guys are doing a great job with that, disseminating it. But other than that, no, I don't have any opinion on that.
Okay, thank you.
Ms. Iaquinto?
Yep. Thanks so much, Mr. Quinn, and I will ask my standard question, which is, have you had an opportunity to attend any of the committee meetings as of yet?
Not in person, no.
Have you observed them been online, watching
Yeah, when
recordings?
I can, yeah.
Okay, great, thank you.
Sure.
No other questions from the board? Very good. Thank you, Mr. Quinn.
Sure.
Our next applicant is Robert Michael Rudman. Mr. Rudman, if you could join us at the microphone.
I go by Mike. It's my mother's fault. So, I stopped flying 15 years ago. I learned to fly at Alpha One at Plymouth. I owned an airplane. I leased it back. I had a wonderful experience. Got an instrument rating when I moved to Long Island. Got to fly for Angel Flight. And always viewed Plymouth Airport as just a marvelous community resource. And I also recognize it's an economic engine. I haven't been associated with it for at least 10 years. in response to your question, I downloaded the runway expansion plan and it broke my printer, which I suspect is true of any time the FAA gets involved. But the idea of being involved, I have to blame my wife a little bit because I'm retired and she was suggesting that I get a job. But I would rather do something that I really enjoyed. And when I saw the application come up, I applied. I've been on the shelf. I had back surgery a month ago. I have not attended any of the meetings. I have ongoing concerns about safety issues at Plymouth Municipal, particularly with increases in traffic, what I perceive to be an increase in jet traffic. And I understand that adjacent residents are always concerned about it. My background is in human resources. I was a labor negotiator for about 30 years, and then I consulted for a Massachusetts nonprofit, Associated Industries of Massachusetts. So I view myself as kind of a conciliator, and I think that that might be useful.
Very good, thank you. Mr. Canty?
You touched on it a bit, but I'll give you an opportunity to expand. Do you currently have an opinion on the operations of the Plymouth Airport?
No, I do not.
Okay. Well, that was a short expansion. Thank you. Is there, if you were to be appointed to the committee, is there anything that the committee is currently doing that you'd like to see them continue doing, or anything that they're not doing that you'd like to see them start
I
doing?
don't have enough knowledge of what they've been doing to have an opinion on that. I just don't.
Okay, thank you.
Any other questions? Thank you very much. So we have one 3-year term, and we have 3 applicants. So I'm going to ask each member to vote for only one candidate. And I'll start with Mr. Cohan. For whom do you vote?
James Buckley.
Mr. Buckley. Mr. Quintal?
Mr. Buckley?
Another for Mr. Buckley. Mr. Canty?
Mr. Buckley.
Ms. Iaquinto?
Mr. Rudman.
I think your microphone was off.
Oh, Mr. Rudman, sorry.
One for Mr. Rudman, and I also vote for Mr. Rudman. Mr. Buckley has 3 votes, so he's been appointed. Congratulations. Please get sworn in by the town clerk. Our next committee appointment is for an alternate for the Board of Health. It's a 1-year unexpired term. We have 9 applicants. 1 has withdrawn out of the original 10. I'll go down the list as they appear on the agenda. First is Lauren Davis. Is Ms. Davis in the room? Is she online? Excellent. Ms. Davis, we are working on getting you into the room. You are here.
I'm here.
Excellent. If you could just give us a brief introduction to yourself and why you'd like to be on the committee.
Sure. It's a little wordy, but I timed it for under a minute.
I'd love that.
All right. Good evening, board. Thank you for your time. I'm Lauren Davis, the mother of a small child. I appreciate the hybrid option of joining this meeting. It makes life a lot easier around bath time. I'm a local homeowner and mental health therapist. My family's been summering here at White Horse Beach for generations, but this is our first time living in Plymouth full time. We relocated from Boston last summer following the birth of our child. My family history in Plymouth goes back to 1623, and my late grandfather, John Finnegan, recently served as state auditor. Recent, was in the 80s. I have a family member who works as a nurse at BI Plymouth, and another family member who was treated quickly and well at BI Plymouth recently before being life-backed into Boston. So hearing about the status and the proposed plans for increasing the hospital size and both quality for the people that work there and receive treatment was greatly encouraging to me. All this to say, my history is here in Plymouth, and I've chosen to root and raise my family here as well. I'd welcome the opportunity to contribute my skills and time to help that ensure public information is communicated clearly and consistently, especially to any residents who might otherwise fall through the gaps. I thank you for your time and consideration. with my application to serve those as needed.
Thank you. Questions for Ms. Davis? Mr. Canty?
Ms. Davis, if you were to be appointed to the Board of Health, is there anything that the Board of Health is currently doing that you'd like them to keep doing, or anything that they're not doing that you'd like to see them start doing?
I think they've done several good things. I was really encouraged when I found out at the Waterfront Festival, which is by far our favorite thing we do in Plymouth, about the CHIP Act, or the Community Health Assessment. I would like to see the results on that, see how that changes things, how it influences things, and kind of follow that to not completion, but continuation.
Okay, thank you.
Ms. Iaquinto?
Yes, thanks so much, Ms. Davis. I actually have two questions this time, and the first is if you've had an opportunity to attend any of the Board of Health meetings, either virtually or in person?
Yes, ma'am, virtually, as well as the last 3 town meetings.
Great, okay. And then the second question I have is, I noticed that you've also applied for the Cultural Council position, and I was just wondering if you had a preference, like, would you prefer to serve in one role or the other?
I don't at this time. I have a pretty intensive arts background. My husband's also a musician, very precocious toddler, so I think it's more like serving at the pleasure of where the board feels I might be best fit, especially if there are considerable candidates for other positions as well. So I am happy with both as long as it improves the town.
Thank you so much.
Sure.
Other questions? Thank you, Ms. Davis. Our next applicant is Dr. Paul DiFrancesco. Is Dr. Paul in the room? Online? Okay. Our next applicant is Teresa Harmon. Is Ms. Harmon in the room? Online? All right, we'll move along. Brianna Keating is the one who withdrew. I just want to confirm, is Ms. Keating in the room? Online? Very good. Our next applicant is Karen Martin. Come on up.
I actually go by Carrie. I've been an EMT for 19 years now. I moved to Plymouth in 2018. I've been working in healthcare for Cape Cod Healthcare for 15 years in various different roles, and I just want to give back to the community.
Thank you. Questions? Mr. Canty.
Mr. Martin, if you were to be appointed to the Board of Health, is there anything that the Board of Health is currently doing that you'd like to see them keep doing, or anything that they are not currently doing that you'd like to see them start doing?
I actually haven't been able to attend any of the Board of Health meetings yet, so I'm not up to date on what they're doing.
Okay, thank you.
Any other questions from the board? Thank you very much. Oh, sorry. Mr.
I
Cohen?
do have one question, I'm sorry. Maybe it's already been asked, I didn't hear it, if it was. Have you had a chance to attend any, did we ask that question?
The applicant indicated that.
Okay, you had.
Yeah, I haven't had a chance to attend any of the meetings yet.
Okay, very good, thank you.
Our next applicant is Catherine Ann Marini. Come on up.
Good evening. I have applied for this position, Catherine Marini. I've been a registered nurse in Plymouth since 2004, worked in a variety of roles, including at BID Plymouth, actually, for 22 years. Currently the Director of Nursing at Newfield House. I have taught high school for 5 years. I've started 2 successful CNA programs myself. I have lived in Plymouth my entire life, 3rd generation, and I have raised 3 children and 2 stepchildren here. So I'm just very interested in becoming more influential, active, and involved in the health of Plymouth overall.
Thank you. Mr. Canty?
Thank you. Is there anything, if you were to be appointed to the Board of Health, is there anything that the Board of Health is currently doing that you'd like to see them keep doing, or anything that they're not doing that you'd like to see them start doing?
Currently, I have attended 2 meetings recently with them working on the banning of kratom products. I feel that's very, very important. I was vice president of the Plymouth Recovery Center and worked with Bob Hollis to get that opened in 2017 to 2018. I self-authored and published a successful book after the death of my sister from the opioid epidemic, giving my perspective in the town of Plymouth, actually, which is still a very popular sell and gives a lot of important feedback in the drug epidemic, the homeless situation, domestic violence, and so on. So I would love to see them continue that work as far as educating our youth and things like that. Plymouth Youth Development Coalition does a lot with that. I was very actively involved with them for many years. I would like to see the town as a whole more involved with our trades in the high schools. I worked at Silver Lake High School for 5 years and was really impressed with how far those projects have come and how talented those young people are, and I think that's a huge investment opportunity for us. So I would like to explore that further.
Okay, thank you very much.
Other questions? Ms. Iaquinto?
Thank you so much, Ms. Marini, for your overview, your background, and your involvement in health in the community is very impressive. Have you had an opportunity to attend any of the Board of Health meetings, either in person or virtually?
Yes, recently I attended 2 on the banning of kratom products. I actually spoke at both. I was also at the hearing for the Kingston Board of Health meeting where we did successfully ban that, and I'm attending the one in Mansfield coming up next week.
Great, thank you.
Yes.
Other questions? Thank you very much.
Sure. Thank you.
Our next applicant is Christine Moylan. Is Christine in the room? Is she online? All right. Our next applicant is Isaiah Riley. Is Isaiah in the room? Online? Nope. I like this. Makes our job easier. Our next applicant is Cameron St. Laurent, I think is how you say it. Excellent.
Yeah, St. Laurent,
It
yeah.
appears as one word on here.
Yeah, yeah. It's 3 ways to spell it. Cameron, been a resident of Plymouth for about 15 years, owned for 10. I've been a nurse for 10 years. I've been in critical care, recovery, home care, and in supervisory roles. My mother actually owns a home care company serving the South Shore, TLC Private Home Care, that I've worked for her for about 5 years. Why I would like to do this is I've always been interested in it, and I saw an opening. I'd like to help my community. I'm actually expecting my first child in a couple months. So
Congratulations.
That kind of, thank you. Gave me a little boost for that, so.
Very good. Questions? Mr. Canty?
Thank you. Is there anything, if you were to be appointed to the Board of Health, is there anything that the Board of Health is currently doing that you'd like to see them keep doing, or anything that they're not currently doing that you'd like to see them start doing?
Not particularly. I know it's probably very busy. I've heard 160 liquor licenses on the first thing we had. So, I mean, I know that they're very busy, but I don't really have an opinion.
Okay, thank you.
Ms. Iaquinto?
Thanks so much, Mr. St. Laurent. Have you had an opportunity to attend any of the Board of
I have
Health
not.
meetings?
I have not.
Not yet. Okay, thank you.
Other questions? Thank you very much.
Thank you.
Our last applicant is Yanire Zamora Rodriguez. Is Yanire in the room? Online? Okay. Well, we've had 4 applicants that appeared either in person or virtually here tonight. That would be Davis, Martin, Marini, and St. Laurent. It's for a single-year term as alternate. I'll ask each member to cast a single vote. Mr. Cohan, for whom do you vote?
Catherine Maury.
Mr. Quintal?
Catherine Marini.
Mr. Canty?
Catherine Marini.
Ms. Iaquinto?
Catherine Marini.
And I also cast my vote for Ms. Marini. Congratulations, you've been appointed alternate. Please make sure you get sworn in by the town clerk.
Tomorrow.
Yeah.
No, you have time.
Our next appointment process is for the Cultural Council. Ms. Davis spoke to it in her last presentation. She'd be happy to serve on either, and she has that arts background. I'll ask again, is Yanire in the room? Online? Ms. Davis, I'm happy to give you another opportunity to speak if you'd like, but I'm also happy to take a vote from the board. Ms. Davis, if I see your hand is up, I'm happy to give you the floor. You are in the room. Please unmute yourself and say what you'd like to say.
Thank you. Technical difficulties.
No problem.
Equally passionate about the arts and our cultural involvement. I feel really passionate about this, and I've also been thinking about a lot of ways that we could expand upon the Plymouth Family Network to also include arts initiatives as the parent of a young child. So that is what I'm thinking for the Cultural Council.
Thank you. Questions from the board? Mr. Canty?
So, Ms. Davis, similar to my prior question to you on the other board, but is there anything that the Cultural Council is currently doing, if you were to be appointed, that you'd like to see them keep doing? Or anything that they're not doing that you'd like to see them start doing were you to be appointed?
I think my primary motive was in applying to the Board of Health, and then I also saw Cultural Council was open. So it's not something that I really have much time that I've spent looking into it, but I've got tons of ideas and lots of kind of not coalescing, but overlapping interests as an expressive art therapist. So I'm hoping that there might be some health-focused initiatives that could be implemented in an artistic way as well. And there might be some opportunities for partnering with local therapists and the homeless population, as well as the gentleman that presented earlier on the family shelter.
Okay, great. Thank you.
Other questions? All right. Is there a motion to appoint Ms. Davis to the one-year term?
So moved.
Mr. Canty makes the motion. Is there a second?
I'll second.
Ms. Iaquinto seconds. Discussion? Ms. Iaquinto?
Yes.
Mr. Canty?
Yes.
Mr. Quintal?
Yes.
And Mr. Cohen?
Yes.
And myself, yes. Congratulations, Ms. Davis. Please get sworn in by the town clerk. Our next appointment is for the Memorials Advisory Committee. We have 3 terms. One is a 1-year term, one is a 2-year term, and one is a 3-year term. I'll ask that each of the applicants that come up express whether or not they're interested in a specific term or if they're open to any of them. Our first applicant is Keisha Adarqua. Is Keisha in the room? Keisha is online. Keisha, you're here. Please unmute yourself and give us a statement as to why you're interested in this committee.
Thank you so much for giving me the opportunity to speak. And yes, it's Keisha Douglas, so very close. I prepared very brief remarks, so I'll just read that off super quickly. So I'm interested in serving on the Plymouth Memorial Advisory Committee because I'm committed to honoring individuals whose contributions have strengthened and shaped our community. I have a background in public service, government operations, HR coordination, and community engagement, and I believe these have prepared me to support the committee's responsibilities. As district director for a state senator and a legislative aide, I've developed strong skills in public communication, scheduling, coordinating, and working with municipal departments. I also bring experience in managing records, maintaining inventories, and preparing formal documentation, which will support the committee's work. Most of all, though, I am a new resident to Plymouth, and I have a deep installment of working in service and giving back to my community. And because I am new to this particular community, I want to do more, and I would love the chance to do that through this committee.
Thank you. Are there questions from the board? Mr. Canty?
So, thank you. I have a few questions. So, Service on the
Absolutely.
Memorials Advisory Committee can be different than other boards and committees that we appoint to. It is primarily tasked with applying a policy that's established by the Select Board as to whom meeting certain criteria would or would not qualify for a memorial. And it's often the family members of people that have died that are the applicants and are seeking to have their particular loved one or relative memorialized in some fashion. Do you believe that you would be able to apply a policy that you do not personally set in that type of scenario?
Absolutely. So I think that's a great question. While I think there's a certain level of empathy and understanding that has to come from, every single applicant that is coming through, there is a set of standards, and, we do have to follow policy for a reason. So while, those applications that are coming through, we completely and we appreciate them applying that policy and making sure that it applies to, each application is very much important. So I think my background in HR, where, you have to do things like compliance, and as a district director, where you have to go through so many different things, especially working with different municipalities, I think my background in those two specific regions really helped to lend to that particular task.
Okay. You sort of touched on that a little bit, my next question a little bit, but I'll give you an opportunity to expand it. Do you have any personal or professional experience in giving difficult news to individuals or families that are in a vulnerable emotional state?
Yes. So I did touch a little bit upon it. I served as a district director for a state senator during the 2020 pandemic. So as you can imagine, that's dealing with a lot of people who are dealing with a lot of stress, dealing with a lot of strife. And it's really just kind of advocating for those folks. But sometimes the news is not great news, right? So just being able to deliver that news in a manner in which we're still acting with grace, but also giving people options if we can't give them the best option for them or give them the news that they need. So I definitely have experience in that realm. And when it comes to my current job in HR, there are those conversations every single day. Hey, sometimes we have to let people go, and it's not the best conversation to have, but sometimes it must be one that has to be had.
All right. And lastly, if an applicant were, if there was an application for someone to be memorialized that you knew personally, were to come before you, would you recuse yourself from assessing that particular memorial?
Absolutely. So I think that it's important that there's a certain level of removing yourself, especially if it's somebody that you do know personally or have connections with. It wouldn't be correct, in my opinion, to have any kind of play in that. It should be something that comes from a place where it's a level playground. So I 100% would bow out gracefully in that situation.
Thank you very much.
In anticipation of Messiah Quinto's question, I'm just going to say this committee has been on hiatus for approximately a year, so it's unlikely that anyone would be able to attend those meetings. But if you have a different question,
That
please,
was not going to be my question.
please go ahead, Messiah Quinto.
Mr. Golden, see what happens when you assume. No, I was just curious. There are 3 different terms here, Keisha. There's a 1-year term, a 2-year term, and a 3-year term. Do you have any preference for how long you'd like to serve in your first go-around here?
No, so I don't have a preference myself. I'm really just eager to be a part of the community and get my hands dirty. Like I said, I'm new. I moved to Plymouth about a year ago, so I'm just looking to give back in whatever way I can.
Okay, great. Thank you.
Other questions?
Thank you.
Thank you very much. Our next applicant is Alice Baker.
Thank you. Good evening. My name is Alice Baker, and I have been living, I've owned my own property here for 50 years in Plymouth. I am a chairman of the Manamet Village Steering Committee, and I have been a member for 13 years. I have served on other committees such as the Sims House, the Task Force, White Horse Beach Parking Committee, the White Horse Beach Bartlett Pond Watershed Group, and I am tonight to hopefully be appointed to the Memorial Advisory Committee. Give you a little bit about my background. I've been 25 years in banking. I was a supervisor and a loan officer for the Educational Student Loan Department. I've also did 20 years in real estate. I was a realtor at New Hampshire and Massachusetts at the same time for 20 years and a short sale specialist. That's my background. Right now I am retired and I'm working in Plymouth as a community activist. I've been a community activist most of my entire life. As far as the Memorial Advisory Committee, yes, I have been to memorial meetings. What really touched me on this was that, and I know Mr. Canty probably going to ask the question about a connection of what would you do or what you wouldn't do. I actually had the experience in getting involved when they came, a family and residents came to a committee, the steering committee, just for support to see how they could go about a memorial. I helped them, but I didn't just help them by sending them over to a Memorial Advisory Committee. I went with them, I followed them. I went through the whole application. I went through the whole entire process. And this was for a firefighter for Plymouth. And let me tell you something. If that wasn't heartbreaking, I don't know what was. But that's where I took the initiative to say, you know, this is something that I would also like to do. I loved my steering committee. I've been on it 13 years. And hopefully I'm there for the next 3 years. And the experience of watching the family and the friends that come out, the residents that came out to support this firefighter, he was a hero, let me tell you. And what it is that I wouldn't change anything in the policy that they have, the existing policy, because we went step by step through that entire policy. I went to the Memorial Committee, all the ways even here to the Select Board. And let me tell you, it was perfect. Perfect. I wouldn't change anything. That policy was perfect. And I truly believe that anyone on the Memorial that gets on this committee, or anybody who applies, anyone who applies for this, they need to go through that policy. Because when you go through it, everything is going to be done right. We have rules and regulations and policies for a reason, and that's why we should abide them. And I'm big on policy, and I think you guys know that. So if it wasn't, you know, and I have families of police and fire department in my family, but when I went through that entire process from the first time that application was filled out. Let me tell you, when the application was first done, there wasn't a memorial committee at the time. We had to pull back because I had reached out to Harry Helm at the time and said, what do we do? Well, the select board filled it. We waited the year, went through the process, and I'm going to tell you something. If it wasn't for that policy, the way it is written today, that wouldn't have gone off so well. And that memorial was perfect, and I just fell for it. I'm just speaking from the heart on this. And the firefighter, in fact, it was Paul Azieff, and he deserved it. And it was great. It was really, really great, and he was a hero. Thank you. Any questions?
Mr. Canty?
So thank you, Ms. Baker, and I am going to ask my questions, but since you did address them sort of, I will
That's okay.
give you an opportunity to respond to them in a slightly different light than you extrapolated on them just a moment ago. So I understand you spoke about the policy and you're familiar with the policy, which is good. I agree with you that if you're applying, particularly with this particular committee, where you're applying a policy that you do not, as a member of the committee, get to set, I think it's imperative that you have an understanding of that. If not when you get appointed, at least before you attend your first meeting. But it's good that you already have an understanding of that. And I know you said you wouldn't change a thing in the policy, but again, it's not a policy that you set, and it's possible that that policy could change. And then you would have to apply that changed policy. Would you have any difficulty applying a policy? You seem to like the current policy, but let's say it changed in a way that you disagreed with. Would you have any problem applying that policy, even though you did not set it yourself?
Okay, maybe I'm going to clarify that. When I said this policy is great as it is today, that I meant as it stands right now. But yes, if there had to be modifications made to it, absolutely, because there's a reason for modifications. So then that way it would be up to the select board to make those decisions. But, yeah, if there's, because everything changes. Rules change, bylaws change. If it needs, something that has to be changed, absolutely.
Okay, all right. And do you have any personal or professional experience in giving difficult news to individuals or families in a vulnerable emotional state?
If it was someone close to me, I certainly wouldn't vote, I'd abstain from voting on it, if that's what you're talking about, or did I misunderstand you?
That's the next question. This one is more, some of the people that apply are not going to be granted a memorial, presumably. So you would be in a situation where you might have to tell someone, a grieving family member or a grieving family, that despite the loss that they presumably care very deeply about, that the person that they applied for is not going to be memorialized by the town of Plymouth.
Well, if that's what the policy is, and if they're not qualified, they're not qualified. It's hard to do that, hard to tell somebody that, but, that's what the policy says. And I'm a believer of going by the policy. So if the policy says they're not qualified, unfortunately, it's harder to tell them that, but they have to be told.
And you'd feel comfortable telling them that in that scenario?
I'd feel awful, but I'd feel comfortable in telling them, yes,
Okay.
because that's the policy.
Okay. And you touched on it, but just to highlight, if you knew I understand working through the process is very admirable, and I don't mean to take anything away from that.
No.
But if you are on the committee issuing the recommendation, obviously it's different than working someone through a
Right.
committee that you're not a member of. But if you were one of those deciding, in fact, at least issuing the recommendation, if you knew that individual personally, you would recuse yourself from that
Absolutely.
application? Okay. Thank you very much. Appreciate that.
Ms. Iaquinto?
Thank you, Ms. Baker. Just curious, in terms of the term that you'd be interested in, if you have a preference for the one-year term, the two-year term, or the three-year term?
3 years.
The three-year term is your preference. Thank you.
Other questions? Thank you, Ms. Baker.
Okay, thanks. Thank you, everyone.
Our next applicant is Beth Dorman, but I had a note earlier that Beth has withdrawn her application. Is Beth in the room? Online? Okay, seems as though Beth has indeed withdrawn. Our next applicant is Jeanette Kelly.
Hello, I'm Jeanette Kelly. I've been a resident of Plymouth for the past 35 years. I've raised my daughter here in Plymouth, and I've worked full-time as a certified dental assistant office manager. I retired 10 years ago, and I decided to start volunteering my time to the town. I became a town meeting member back in 2014. Currently, I'm the chair of Precinct 14. I've been on the steering committee for the past 8 years with Alice Baker. I serve as the vice chair. I also served on the, oh God, excuse me, Conflict of Interest Subcommittee back in 2014-15. I was also on the Capital Improvement Committee for 2 years, and I also volunteered for the Symes House. I was on the Symes Manomet Village Commons for 3 years. So, any questions? You can tell I'm nervous. I'm terrible
right.
at speaking in public.
No problem. Mr. Canty?
Thank you, Ms. Kelly. So I'll ask you my standard 3 questions. So this is a committee that applies a policy that they do not set, and a policy that could change at any time. Would you have any difficulty applying a policy in this scenario that you did not yourself have any input in setting?
Absolutely not. I wouldn't have a problem.
Okay. Obviously, some of the applicants will not be approved for a memorial, presumably, which could be very difficult for those individuals or families. Do you have any personal or professional experience in giving difficult news to individuals or families that are in a vulnerable emotional state?
No, I haven't. No.
Okay. And if you were to be appointed and you were hearing an application to memorialize an individual that you knew personally, would you recuse yourself from consideration of that particular memorial
Yes,
application?
I would.
Okay. Thank you very much, Ms.
Thank you.
Ms. Iaquinto?
Yes. Thank you so much, Ms. Kelly. So do you have a preference for the term, the 1-year term, the 2-year term, or the 3-year term?
3-year term.
The 3-year term? Okay.
Other questions? Mr. Cohen?
You've done a great job tonight, like everybody else. You've done an excellent job speaking. I remember the first time I applied for a job 25 years ago on the committee, and it is nerve-wracking, so you did a good job. In the capacity of the Memorials Committee, obviously, there's quite a few requests that are coming in the thought process of responding to people in a timely manner. Obviously, people have to wait a year. Do you feel like you have the time to dedicate to this committee with your other responsibilities?
Absolutely. I have plenty of time.
All right, thank you very much.
Any other questions from the board? Thank you, Ms. Kelly.
All right, thank you.
Our next applicant is Jennifer McIver Edwards.
Hello, it's nice to speak to you all tonight. I'm a Plymouth resident for over 10 years. I grew up in Carver. I run the Community Art Collaborative, so I do a lot of work here in town. I've found that over time, the conversation around civic discourse and things of that nature is something that is increasingly important. I think that the Memorials Committee and what we're bringing forward, whether we're honoring a citizen who has recently deceased and provided, input to the town, or someone who has many years ago maybe not been recognized for their input. It's a great opportunity to walk through the policy and to bring those stories to life. And I think that this committee, and sometimes you're going to have hard decisions where you might not be able to actually create memorials, but there are other alternatives like the Cultural Council and things like that. So this committee can take and apply policy, but also make recommendations about other ways to honor those important lives and tell the stories of those individuals. I think there's also an opportunity for some of the younger people in town and education to be brought into this and to understand how policy works and to influence civic discourse. The fact that this committee has not met for over a year or two, but yet there are certainly extraordinary people, means that we need to bring some new lifeblood into this. And as we hit the 250, the commemoration, it's a good opportunity for that. There are a lot of interesting, thoughtful stories. So I'm excited about being part of this and helping the community to think about things in a bit of a different way and to serve with others to do so. I do not have a term commitment in mind, but I'm happy to serve a year or 2 or 3 or whatever suits the select board and the town. I'm just looking forward to participating. I will answer some of the questions about, I am a very busy person, but this is an important point, and it does support other work that's going on in the cultural district and things like that. So these are things that we should be making time for, and I am committed to doing that. I will take any questions that you may have.
Thank you. Mr. Canty?
Thank you. So this, as I've asked previously, this is a committee that applies a policy that they do
Yes.
not themselves set.
Yep.
So would you have any problem applying a policy in this scenario where you do not have any
No.
direct input on how it is established?
Nope, I think that's, no, we can move through that, and, you know, as the others have said, I agree with them. It's set, and if it changes, we'll make the adjustments and move from there.
Okay, thank you for that. Now, this is also a scenario where some of the applications will presumably not be permitted and be denied.
Yep.
Do you have any personal or professional experience in giving difficult news to individuals or families that are in a vulnerable emotional state?
I'm a customer service leader, so by definition, I give hard, you know, we get put in challenging situations every day. It happens to be dealing with business people, but this is when they're dealing with like millions of dollars and they've put their career on the line and things are maybe not going the way they need to. It's a different scenario, but can we equally as emotional for them? And great sensitivity should be given to that when you're handling this. And I've also been on the other side where I am working very hard to deliver something myself, and maybe it hasn't gone the right way, and had to be the receiver of feedback, and I think there's like a lot to be learned from that, too.
Agreed. Thank you. And then lastly, if you were to be reviewing or to receive an application for someone that you knew personally, would you recuse yourself from consideration?
Yes.
You would. Thank you.
Thank you.
Other questions? Thank you very much.
Thank you.
Our next applicant is Christopher McDonald. I have a note that Mr. McDonald has withdrawn his application, but I just wanted to double check. Is Mr. McDonald in the room? Online? Moving on. Our last applicant is Ashley Shaw. I don't see Ms. Shaw in the room. Is Ms. Shaw online? Very good. Ms. Shaw is not online or in the room. Okay, so we have 4 applicants who have appeared before us tonight. 2 have expressed that they don't have a preference. That would be Ms. Adarkwa and Ms. Edwards. 2 have expressed that they'd like the 3-year term, Ms. Baker and Ms. Kelly. I'm going to suggest that we take nominations for each of the 3 terms. I'll start with the 1-year term. Is there any nomination for the 1-year term?
I'll nominate Ms. Edwards.
All right. Mr. Cohen nominates Ms. Edwards. Is there a second?
I'll second.
Quinto seconds. Are there any other nominations? Mr. Canty.
I would nominate Ms. Baker for the 1-year term.
Mr. Canty nominates Ms. Baker for the 1-year term. Is there a second?
I'll say.
Mr. Quintal seconds that. Any further nomination? Mr. Cohen?
Ms. Kelly for the 2-year.
Oh, we're just working on the 1 year right now.
1 year, okay.
Any other nominations for the 1-year term? Ms. Baker, would you accept if we were to vote for the 1-year term? I know you expressed that you were interested in the 3-year term.
I was interested in 3, but if not, I'll take the 1.
Okay, very good. All right, so we have 2 nominations, one for Ms. Edwards and one for Ms. Baker. I will ask each member to cast a single vote. I'll start with Mr. Cohen.
Ms. Edwards.
Mr. Quintal.
Ms. Edwards?
Mr. Canty.
Ms. Baker?
Ms. Iaquinto.
Ms. Baker?
And I vote for Ms. Edwards. Ms. Edwards, you have received the majority votes for the 1-year term. Congratulations. Please get sworn in by the town clerk. I'll move on to the 2-year term. Are there nominations for the 2-year term? Mr. Cohen?
I nominate Ms. Kelly.
Ms. Kelly has been nominated. Is there a second?
Second.
Mr. Quintal seconds. Are there any other nominations? Mr. Canty?
Nominate Ms. Baker for the 2-year term.
Mr. Canty nominates Ms. Baker. Is there a second? I will second. Ms. Baker, I assume you'd take the 2-year since you'd take the 1. Ms. Kelly, would you take the 2-year? Happy to take whichever. Very good. Thank you. All right. Any other nominations for the 2-year term? All right. Each member, please cast a single vote, either for Ms. Baker or Ms. Kelly. Mr. Cohen?
Ms. Kelly.
Mr. Quintal?
Ms. Kelly?
Mr. Canty?
Ms. Baker?
Ms. Iaquinto?
Ms. Baker?
And I vote for Ms. Kelly. Congratulations, Ms. Kelly. You have been selected for the 2-year term. Please get sworn in by the town clerk. Last is for the 3-year term.
Nominate Alice Baker.
Very good. Mr. Quintel nominates Ms. Baker.
I'll second.
Mr. Cohan seconds. Are there any other nominations? Mr. Canty?
I nominate Keisha Ardfa.
I think it's Adarkwa.
Adarkwa.
Ms. Adarkwa, is there a second?
I will second.
All right. Any other nominations? Hearing and seeing none, I will call for the vote. We have Ms. Baker and Ms. Adarkwa. Mr. Cohan?
Ms. Baker.
Very good. Mr. Quintel?
Ms. Baker?
Mr. Canty?
Ms. Adarkwa.
Ms. Iaquinto?
Mr. Darkwa.
And I vote for Ms. Baker as well. Congratulations, Ms. Baker. You've been selected for the 3-year term. Please get sworn in by the town clerk. We've done public comment. Would you like to make an announcement regarding when it will, how the meeting will proceed? Come on up to the microphone. Mr. Lyden is one of the sole members of the existing committee. Mr. Lyden, the floor is yours.
Thank you. I contacted the town clerk, Kelly, and she's going to inform the new members that when they are sworn in, they will also be informed of when she will schedule the next meeting, since we don't have any chair, vice chair, or clerk. So she will schedule the next meeting, and she will get in touch with all of us to schedule that meeting so everyone can be informed when it is. Thank you.
Thank you, Mr. Lyden. Appreciate your continued service on the Memorials Advisory Committee. Our last committee appointment for the night is the Roads Advisory Committee. We have one 2-year term for a resident and a 1-year term for a select board designee. Ms. Anderton, correct me if I'm wrong, but I believe it needs to be a member of the select board who serves as the designee. Didn't we determine that? Mr. Brindisi, or Lieutenant Colonel?
Thanks. So I think we have 2 appointments tonight, one from the community at large, and then the second goes back to the June appointments where the board was looking for a designee liaison to serve on the Roads Advisory Committee. And I think at the time, the board talked about going back and thinking about, who'd want to take on that, that committee assignment. So Christopher Correa would be up for the at-large seat, and then the board would discuss whether or not they want to appoint somebody amongst themselves.
Well, I'll take it backwards, actually. Thank you, Lieutenant Colonel. Is there anyone from the board who wishes to serve as the representative from the board to the Roads Advisory Committee? Mr. Cohen, anyone else? Unless there's objection, I'd like to appoint Mr. Cohen.
Congratulations,
Very good.
Bill.
Congratulations, Mr. Cohen. We look forward to your work.
Thank you.
We have a single applicant for the 2-year term, Christopher Correa. Is Christopher in the room? Come on up.
I'm Chris Correa, Plymouth resident, lifelong Plymouth resident, 40 years. I went to...
Is your microphone on?
The button's on, yeah.
If you could just pull the microphone closer, that'd be helpful. Thank you.
So I was saying, lifelong resident for 40 years, Plymouth Public Schools. I have an engineering background, degree in civil engineering. I've worked in the road construction field for almost 18 years. Built some roads in Plymouth, worked on the airport, did the market basket development, several other projects, worked with the DPW drainage projects. I have not been to a committee meeting, but I thought my background would be useful for advising.
Thank you. Any questions from the board? Mr. Canty.
With the knowledge that you haven't been to any of the meetings, I'll still ask in case you have an opinion. Do you have an opinion as to whether, if you were to be appointed to the Roads Advisory Committee, is there anything that you can think of that they're currently doing that you're aware of, you'd like to see them keep doing, or something that they're not doing that you'd like to see them start doing, were you to be appointed?
Not necessarily, no.
Okay, thank you.
Other questions? Thank you very much. Is there a motion to appoint Mr. Correa?
I'll make a motion to appoint Mr. Correa.
Mr. Cohen makes the motion, Mr. Quintel seconds. Discussion? Ms. Iaquinto?
Yes.
Mr. Canty?
Yes.
Mr. Quintel?
Yes.
Mr. Cohen?
Yes.
And myself, yes. Congratulations. Please get sworn in by the town clerk. And thank you to all of the applicants who applied for our various committees tonight. We truly appreciate your commitment to our community. Moving on to the town manager's report. Will it be you or the assistant town manager?
I will, it's been a long day, as you can imagine. I will defer the town manager's report to Mr. Janea. However, before I do that, I do want to personally recognize Lee Hartman. So for those of you who don't know Lee Hartman, which that's probably hard to imagine because he's been serving this community for 37 years, Lee is retiring this Friday, December 5th. And so for those that don't know his story, Lee came to the town. His first position was the town planner 37 years ago. A number of years thereafter that, he was promoted to the director of planning, where he has served the town for decades. Lee has also served, at least on one occasion, I think 2 occasions, as the town manager. So in the town's most desperate times of need, when they needed the proper leadership, it was Lee Hartman who took that on, and it's not an easy job, as you can imagine, and he did it, so graciously and really led this town through some rough waters. For me personally, Lee Hartman has been someone, when I was the assistant town manager and returned as a town manager, who been really my advisor. When I had questions or needed advice, oftentimes I would find myself in Lee's office asking him for advice. And so I think we can all agree that we're going to miss Lee Hartman when he's gone. But I wanted to take the time and recognize, his retirement and wish him well in whatever he chooses to do next. I know he has grandchildren that live out west that he's looking forward to visiting often. So Lee has had a number of going away events, as you know, ZBA and Planning Board and the Planning Department had one just yesterday. So we will be wishing Lee well in the future as we start to organize, our ideas on the best way to thank him for, again, 37 years of service. So I wanted to say that publicly. I know we mentioned it at the last town meeting, but it's important for the folks that are at home who don't typically watch town meeting, know the dedication and commitment that Lee Hartman had to this community. So pending any questions, I'm going to turn the rest over to Sylvia.
I think the board would join you in your gratitude for Mr. Hartman, and I'd ask that the audience here today join us in a round of applause for his many years of service. Thank you, Mr. Hartman. I'm sure you're not watching. Mr. Janeo?
Thank you, Mr. Chair. I'm just going to keep it brief. Couple of updates on the Jenny Gristmill project. The water main work will be finished by the end of the week, and subsequently the sewer line work will begin soon after, along with a couple of sewer services. Currently, they're also working on a bypass channel to replace the weir soon, and they will expect to be out of the road by Christmas. Moving on to Health and Human Services, the Medic Now Foundation and the Plymouth Area Veterans Center are donating 1,000 prepared meals to veterans, active duty, and military families across Plymouth County on December 23rd, 2025 from 3 to 6 p.m. For more information, and if you're looking to reserve your meal now, please contact Roxanne at the Office of Veteran Services. The VFW is also organizing a toy drive and is now accepting names of children in need. To put in your child's name, please contact Dennis Russell, Commander of the VFW, at 508-340-0292 with the child's name, age, and information so that they can coordinate delivery. Moving on to DPW projects. The DPW recently installed a curtain drain at Memorial Hall using an outside contractor last week. And with the rain coming in today that we've all been experiencing, They will be monitoring its functioning. At the intersection of Long Pond and Halfway Pond Road, the last piece of the process will finish with the installation of 2 mast arms for the traffic lights. These will be installed tomorrow and Thursday, and for the next couple of weeks, we'll be blinking just to make drivers aware of its new location. And at the end of those 2 weeks, then they will go on fully operational. The Plymouth Recycling Committee, in partnership with the DPW, will be hosting a special holiday reopening of the Swap and Shop on Saturdays, December 13th and 20th from 9 a.m. to 12. At 33 Hedges Pond Road, there will be welcoming donations of toys, decor, and more for this event during the holidays. And finally, an update to the Route 80 sidewalk. The contractor will be placing the asphalt binder course tomorrow, and will continue working on the project for the rest of the week. So the asphalt binder course is the first layer of asphalt, and they will continue working, eventually putting the final layer of asphalt on that sidewalk. Moving on to planning and development, the master plan is on its final stages, which will include identifying action items in order to achieve the previously identified goals. In order to do so, the consultant will do a public engagement with the community sometime in January to show the master plan to the community, and then will be presented at both the planning board and the select board for your review and approval. And lastly, we would like to remind everybody that nomination papers for next May's election will be available at the town clerk's office on January 5th. And as the manager says, if you don't have any questions, we're good to go. But if you do, I'm available for questions. Thank you.
Questions from the board? Mr. Canty?
I don't have a question, but I did want to follow up on the Lieutenant Colonel's remarks about Mr. Hartman. I have said before that the reason I got involved in town government 12 years ago was when I grew up in Plymouth. I just turned 40 recently. When I grew up in Plymouth, it was a really great place to grow up, and I didn't have to worry about a lot of things that some other kids have to worry about. It's very safe, well-run community. And as I got older, I realized that a lot of that peace of mind that I had as a kid was because of the hard work of employees and volunteers that gave a lot of their time to make Plymouth what it is. Obviously, Lee has worked in this town for most of my life. I've been fortunate enough to get to know him over the last 12 years that I've been involved, and he is a consummate professional. He is at meetings, he goes to caucuses, he answers questions at meetings that he's not even expecting to be asked about topics he's not there to cover. And I know he has opinions on things, but he always puts those opinions aside when answering questions and just gives the factual information so that the people making the decisions can do that in a fair way with valid, objective information. And I think that Plymouth is an institution in a lot of ways, but so is Lee Hartman. And people like him, and there are other people in the community, Lynn Barrett comes to mind. They are true assets and pillars of what makes our town function. And I think that their absence will be felt in ways that we can speculate about, but will not fully appreciate until they are gone. I thank Mr. Hartman very deeply for the work he's done over the years, and he will be missed. Thank you.
Anything else from the board? Thank you, folks, very much. Select board discussion, new business? Letters? Mr. Cohen?
I think we all received a letter from a resident of the White Horse Beach area about barrels on the beaches. I think that's an important thing to note. I want to thank staff for a quick response to the inquiries about the barrels that are out there to receive trash when people visit places like White Horse Beach and Plymouth Beach and the different parks. Obviously, the weather has been holding, and as long as it holds, I think that we should try to keep barrels not only at White Horse Beach, but at least, a sporadic, one or two barrels. I know they're at Stevens Fields and Nelson Park, but a few other places they've disappeared. But people still go and visit these locations. They hike, they spend time, and they might generate some trash. So we might think about places like White Horse Beach and in Morton Park, keeping a barrel out a little bit later in the season and bringing it out earlier in the season. So just keep an eye at traffic on the visitors we have to our public spaces, and making sure they have barrels. So I appreciate the quick response at White Horse Beach.
Thank you, Mr. Cohen. Other letters? Old business? Mr. Cohen.
Yeah, I do have old business. I wanted to take the time, I've made it known to my fellow board members, and I've had a chance to speak to the town staff about an issue that came up in the last week or so. There was a series of newspaper articles in the Boston Globe and the Plymouth Independent and WBUR talking about the agreement that the town of Plymouth had with the native population after the 1998 concerns. It indicated that the town of Plymouth was pursuing altering that agreement. I think that when the town, I was unaware of this discussion until after the court proceedings. I think in the future, I just wanted to go on record that I was unaware of this policy being discussed. And I think that hopefully in the future that those discussions will come back to the board before they reach a level where we're not all well informed of the requests that we're making. That when a board in 1998 drafts, negotiates and signs an agreement, I think that any alterations to that agreement or issues with that agreement as we pass through time should be brought back to the board, so the board is kept informed at all times. So I look forward to working with town staff and my fellow board members in the future, moving forward in a more constructive, more informative way. So I just wanted to take the time and make note of that.
Thank you, Mr. Cohen. Any other old business? Our next meeting is going to be on December 9th. It's going to be an on-the-road meeting at Cold Spring Elementary School. Is there a motion to adjourn?
So moved.
Mr. Canty makes the motion. Is it seconded?
Second.
Ms. Iaquinto seconds. Any discussion? Mr. Cohen?
Yes.
Mr. Quintal?
Yes.
Mr. Canty?
Yes.
Ms. Iaquinto?
Yes.
And myself, yes. We are adjourned.